and awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of our Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the
Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. With the children of our Mother Earth, reach out your hands. Let us heal our earth together. Welcome to the brand new world. With the children of our Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Tomorrow will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of a Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of a Mother Earth.
Namaste. Please join us this Sunday on a free global online episode, Cancer Care and Awareness.
Stars, they can tell you stories which are brighter than yesterday. The streets have never been so quiet. The squirrels found a new hideaway.
Will never be the same. There is so much hope in our hearts. Brick by brick, we shall overcome and walk right into a new start.
Welcome to the brand new world. We're the children of a Mother Earth. Reach out your hands, let us heal our earth together. Welcome to the brand new world. We're the children of a Mother Earth.
Namaste. Please join us this Sunday on a free global
10, 9, 8, 7, 6, 5, 4, 3, 2, 1.
Namaste. Good morning, good afternoon, good evening to all the viewers of Healing Our Earth, wherever you are connected to us. This is Dr. Amrita Sharma. I welcome you to 198th episode at Healing Our Earth. Today's episode is Cancer Care and Awareness, acknowledging World Blood Cancer Day and other type of cancers. We have some of the eminent speakers as well as experts lined up for you. Before we start this episode, let us begin with a short prayer. Mine is Gayatri Mantra. You may sing any affirmation that suits you. Let's close our eyes. Om Bhurбhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurбhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Om Bhurбhuva Swaha Tatsaviturvarenyam Bhargo Devasya Dhimahi Dhiyo Yo Na Prachodayat. Shanti, Shanti, Shanti. With that holy sign, let's commence today's session and welcome our first speaker from India, Dr. Amrita Gaikwad. Global Namaste, Dr. Amrita. How are you? Please unmute yourself.
Global Namaste, everyone. Hello, Amrita ji. I'm doing very well.
Hello.
How are you doing?
I'm doing good. And what all things are there and how is the weather over there in India from your side? Because you come from South India.
Yes, I do. Yes, I do. And it's quite hot here. So you can say it's the intense summer which is getting in. So we are expecting monsoon soon, though. But here we have showers here and there, but the heat is very like scorching heat. Yeah.
Okay. So before your presentation begins and we have a further chit chat, I'd like our viewers to have an introduction. So I'll be reading out your short introduction. Dr. Amrita Gaikwad is highly accomplished Ayurveda practitioner based in Bangalore, Karnataka, India. With a background in Bachelor's of Ayurvedic Medicine and Surgery, as well as an MD degree in pharmaceutic and itrochemistry, she possesses extensive knowledge and expertise in her field. Her passion lies in researching and developing Ayurvedic formulations for the treatment of breast and cervix cancer, making significant contribution to the field. Dr. Gaikwad has been recognized for her exceptional academic achievements and was awarded a gold medal by RGUHS in Bangalore, Karnataka. With a deep understanding of Ayurvedic principles and commitment to improving healthcare, she is dedicated to providing holistic and effective treatments to her patients. Welcome once again, and let's see what we have from her today. Over to you. So over the 20 minutes, we have your presentation and we can quickly chit chat. Thank you.
Sure. Thank you. Thank you, Dr. Amrita Sharma, for the brief and short introduction. So, global namaste, everyone. This is Dr. Amrita here. So, without wasting much time, I would like to move on to my presentation today. So, today I will be focusing on creating an understanding and awareness on blood cancer.
Yeah, full screen. Can we have the full screen, please? Yes, perfect. Thank you.
Yeah. Okay. So we all know that today we are gathered here on this global platform on the eve of creating awareness regarding the blood cancer. So there, as Dr. Amrita Sharma said, there are various types of cancer already, but today's main focus will be on the blood cancer. So I will be taking you through the journey of understanding and try to create an awareness from my end. Moving on. So these are the contents of my presentation. I will be talking about the blood cancer, the diagnosis, the signs and symptoms, the recommendations, the pathology involved, the treatment, and at the end, the conclusion of the presentation. So to begin with, so what is cancer? So cancer is a serious disease where uncontrolled multiplication of cells occur. So it may affect any part of the body for that matter. So it need not be just blood or even the breast or cervix. It might affect liver, it might affect brain, it might affect eye, any part of the body. There's no part in the body which is untouched, left untouched by cancer. So it's a very serious hazard or a health hazard these days. And the mortality rate is very high when it comes to cancer. So the only thing which is to prevent cancer is to create awareness among the public, among the people about it. So that is the occasion we are gathered here today. So I would like to say that a lot of research work has been going on in all the fields of medicine, irrespective of the system of medicine, be it allopathy, Ayurveda, homeopathy, any system of medicine. Immense research and immense hard work is put out by the doctors and scientists towards the treatment and providing a better healthcare for the cancer patients. So moving on with the blood cancer. So it is also known as a hematological cancer. So what is a blood cancer? So before that, I would just like to take you through the functions of blood, what it means, how it is present, how much is present, and etc. So blood plays a crucial role in our body because it just not just nourishes the cells of the body, but it is also a ton of functions which it performs, like it has the transport function, protection, regulatory, and thermoregulatory. So in transport function, it carries the oxygen and carbon dioxide. In the sense, it carries oxygen from the blood to the cells and brings back the carbon dioxide from the cells back to the lungs to be expired. So this is one of the transport mechanism of the blood. And another one is transport of nutrients and to the cells and taking back the product of metabolism from the cells to the excretory organs such as liver or kidneys. And another function, important function performed by blood is protection. So we know that blood is composed of mainly three components, that is RBC, WBC, and platelets. So here what happens is RBCs are present in a more number when compared to WBC. So here what RBC does is it mainly does the transport function. But when it comes to protection, this is mainly done by the WBC, that is the white blood cells. So here white blood cells are called as the defenders, or they defend our body against the infections of various types, including cancer. So what it does is it protects our body against any microorganism or any attack for that matter, and it protects our body and health. So then coming to the third component of blood, that is platelets. So platelets are the key perform the key role of forming the blood clots. So whenever we bleed, we see that the blood is arrested in seconds. So that is due to the quick action of the platelets. So a formation of blood clots and hence preventing the further blood loss is the primary protective function undertaken by the blood. Then coming to the regulatory function of hormonal regulations. So we all know that there are two types of like we need hormones for the perfect balance in our body. So if we have the perfect balance, to maintain that, we need our hormones to be regulated very frequently or very often. So that function is also performed by the blood. Then the not just the last function, but here I am highlighting the thermoregulatory function. So here what blood does is it maintains the body temperature. So our body temperature is it varies according to the seasons and also the place where we live. So here I am in humid regions, so here my body temperature will be around 33, 34 degrees Celsius. So it depends. When we are in warmer conditions or warmer regions, our body tries to warm up, cool down our body temperature and bring it to normal. But when we are in the colder regions, our body or the blood keeps our body warm. So these are the basic functions of the blood. So you can imagine what if any of the component of the blood is affected, it leads to the blood cancer. So blood cancer is a type of cancer that starts in the cells of the blood, either in RBC, red blood cells, WBC or white blood cells, or platelets. And it also affects the production and function of these cells. So cancer is not just affecting the production, it also hampers the function of these cells. So coming to the subject proper, so there are three main types of blood cancer. There are leukemia, lymphoma, and myeloma. So here you can see leukemia, it begins in the bone marrow. Let me tell you something about bone marrow. So bone marrow is a primary site where RBCs are produced. RBC in the sense red blood cells, which carry oxygen to our body. Okay, so those are produced in the bone marrow. So leukemia begins in the bone marrow itself. So the RBCs which are produced in the bone marrow, they are affected at that site itself. So what happens is it involves the overproduction of abnormal white cells, which are responsible for fighting the infection. So here the WBCs are infected, because in the previously I said that WBCs are the defenders of the body. They defend our body against various types of infections, right? So they are overproduced. So these abnormal cells crowd. So what happens is when WBCs are they overpower the RBCs and they get crowded, and the healthy blood cells which are supposed to perform their own functions, it gets hampered and they overpower this, and leading to the weakened immune system and also impaired blood clotting. So it also affects the platelets which help in the blood clots. Then another type of blood cancer is the lymphoma. Lymphoma basically it affects the lymphatic system. So lymphatic system is another system of our body which involves the lymph nodes. So lymph nodes are also help in the defending our body from various organisms, from various attacks. So a part of the immune system that helps fight infections. So it occurs when lymphocytes, a type of lymph, it affects basically the lymphocytes where the WBCs grow abnormally unformed tumors. So here what happens is cancer is nothing but abnormal growth of cells which lead to the formation of tumors and in turn lead to the hampering in the function of normal function basically. So coming to the last one, that is myeloma. So myeloma is the one type of cancer where the plasma cells are affected. So here I was talking about the types of components of the blood, right? So it is plasma cells or a type of WBCs. So here what happens here is uh, so here, the WBC's major function is to produce antibodies. So the antibodies are the ones which defend our body against the bacteria or any microorganism attack. So what it does is, in myeloma, the abnormal plasma cells accumulate in the bone marrow and they form tumor. So the tumor here is formed in the bone marrow itself, where the RBCs are produced, and they form tumors, impairing the production of normal blood cells and weakening the immune system. So you can see in all these three types of blood cancers, the end result or the end we can see is the weakening of the immune system or impairment in the formation of the blood cells, or it might also hamper in the normal production of the blood cells. So what will be the symptoms or what does a patient of a blood cancer experiences? So usually it takes a lot of the period is long when the patient notices it, because usually it's either weight loss, fever, fatigue, or there is bleeding tendency, or there is recurrent infections. So these generally appear to be a very common symptoms, but when ignored, they delay the diagnosis of these type of cancers. So if the patient, if a person is suddenly losing weight, if he's having very on and off fever, and if he's experiencing fatigue in spite of all the measures he has taken for it, and there is also a severe bleeding tendency. So when we just have a small cut, our the bleeding stops in just a matter of few seconds, right? So that is the function of the platelets, so which helps us our blood clot immediately and prevent the further loss of blood. So these are the few symptoms. There are no particular signs and symptoms as such, but these are the very general ones. So we have to be very careful if any of our family members or any of our patients come to us with these kind of symptoms. We better screen them for any type of cancer. So I was talking about it. So because the risk factors here, the 90% of the contributing factors are from the environment, and only 10% genetic predisposition is found in this type of cancer. So genetic predisposition is something where we have a tendency of a genetic, somebody in our family have had the history of blood cancer, some of my far relative or close or far relative, or maybe my sibling or my parents, somebody who has had the blood cancer, then there is 10% chance, increased risk of that person being affected with blood cancer. But the 90% of the risk is from the environment. So here I can just quote a few, like environmental factors include exposure to chemicals, which we are very often exposed to chemicals, which unwanted chemicals like benzene, like petrochemicals, etc., and also radiation. So unnecessary exposure to radiations like UV, infrared, or X-rays, or whatever for that matter, is also harmful, and it's a potential risk which can lead to the development of blood cancer. Here, environmental factors also include our lifestyle. So here what happens is we are accustomed to certain set of habits, but we suddenly change them over a period of time, or due to the modernization or westernization or anything, without thinking about it, right? So without seeing whether it suits our body or not, we just try to blindly follow the trend. So that also is a hazard. So coming to the diagnosis. So when we have a patient with all those symptoms, then we take a detailed medical history, saying what is this presenting complaint, what are this past illness? Is there any family history, or is there any such incidences has occurred in the past? So this we take a very detailed history for the diagnosis of a cancer case. So this is the first step. Okay. So when we have elicited the probability of of the patient being having a blood cancer, then we take up the investigation. That is the second one is the investigations, where we talk about the tomography, or this is generally called as CT. So we ask the patient for a set of investigations just to rule out in case if he really has or not. Then last step is the biopsy, that is for the confirmation of the presence or absence of the particular type of cancer. So these are the three major steps involved in the diagnosis. One is detailed medical history, another one is the tomography, that is investigations, and the final one is the biopsy. So based on these, once the diagnosis of the blood cancer is confirmed, then various treatment modalities are adopted based on the patient's condition, based on the disease, and based on the availability. So it might be radiotherapy, chemotherapy, immunotherapy, hormone therapy, or stem cell transplant, or gene therapy. So either of these can be adopted based on the stage of the disease, state of the patient, and also the availability or the feasibility. So these are the available treatment options. Coming to the recommendations. So once we are diagnosed with blood cancer, but still, what can we avoid, or what can we adopt to make ourselves or make the patient's life better, or to prevent? So one is the early testing. So whatever the frequent illness is causing, so we'll have to find out the cause. If the cause is not elicited, it's better to go for a cancer screening of any sort. Okay, that leads to the early testing. So it is one of the primary steps which plays a very major role in the detection and even prevention of many types of cancers. Then avoiding, coming to the lifestyle changes, like avoiding alcohol, smoking, avoiding any such bad habits which have a very what I say long impact on the long run. So for example, smoking, it might lead to that sense of pleasure upon immediate action, but it has a very long term hazard on the body, especially not just lungs, even on the blood. So it alters the what do I say, the pH of the blood, and it leads to formation of clots, and it leads to so many other complications. Same goes with the alcohol. And finally, I would recommend adopting to a healthy lifestyle, or rather I would say an ayurvedic lifestyle, where primary the importance is given to maintaining the healthy lifestyle. So ayurveda says swasthasya swasthya rakshanam aturasya vikara prashamanam. So swasthasya swasthya rakshanam matlab maintaining the health of the healthy person and curing the ailment of a diseased person. So this is the major perspective of ayurveda. So there are certain set of principles which lead us to follow certain things like dinacharya, rutucharya, palana. So all these things can lead us and keep us away from all these type of cancers. And coming to the conclusion about today's presentation, a very small one. Like blood cancer, it can occur in people of all ages. So there is no restriction that it might occur in people above 40, 60, 80. No, even in children, we find many type of leukemia are very common in children. So there is no age restriction. So since from the birth till end, if we try to adopt the healthy lifestyle way, then we might have that 90% in our hand. The rest 10% is genetic disposition. That is, if we have any genetic variation, then that might lead us to the blood cancer. So, in spite of all these diagnoses and eliciting medical history, the exact cancer of blood cause of blood cancer is not known. So we cannot elicit or point and say that this is the exact cause which led to the formation of this cancer in this particular person, or he was smoking, or he was not having alcohol, etc. So sometimes it's, if nothing is also there, but still we cannot elicit the cause. So that is why it is very difficult to diagnose and even treat or manage cancer. So once if we get the causative factor, we can try to eliminate that factor or neutralize it, and we can strengthen our immunity to fight against it. But here we do not exactly know what is leading to the cancer formation. So we have to be very careful of what type of food we take, what type of environment we live, or what is the type of lifestyle we are adapting, and how much importance is given to health. So early detection, appropriate treatment are crucial in the management of all types of cancer and blood cancer as well. So early detection is something here which is regular screening. So we have to screen ourselves to some set of investigations which kind of help us to diagnose if anything is going wrong in our body at the initial stages, so that it can be handled or managed very well without much complications. And appropriate treatment also plays a major role in managing any type of cancer. So here I can recommend the lifestyle which is advocated by Ayurveda. So I was talking about Dinacharya, Ritucharya. So right from the beginning, right from the time we wake up to the time we go to the bed. So a certain set of principles or rules have been laid out. So if we try to follow or incorporate in our lives, we can have a proper channel through which we can help our body to attain that healthy state and live a very stress free life. So stress is anonymous it's inevitable to everybody, be a doctor, be a patient, be a advocate, anybody. So be a even common people. So it's better to adopt a very healthy lifestyle to keep all these at bay. So thank you. With this Ayurvedic thought and with the blessings of Dhanvantari and my gurus, I end my today's presentation. So thank you, everyone.
Thank you. That was a lovely presentation. Thank you so much, Dr. Amrita. A very brief as well as a very simple presentation. And I'd like to ask you, so you concise everything on Swasthasya Swasthya Rakshanam, right?
Yes.
Which is in fact the core of Ayurveda. So in today's time, as you mentioned, that children basically are reported to have more leukemia cases in general. What are the causes, do you think, why children are having these problems? And what is the role of Swasthasya Swasthya Rakshanam for the children in today's time?
Yes, Dr. Sharma. So here I would like to highlight, as I spoke about children having ending up with leukemia, various types of leukemia. So the susceptibility, the first one is the susceptibility. The second one is the genetic predisposition. So the children are more affected because they're in a tender age. Their immunity is not that much like overall developed also. And if there is any family disposition, like if anybody in the family has had a history of any type of cancer for that matter, if their grandfather or grandfather had prostate or grandmother had a cervix cancer, so there is a 10% risk of children developing cancer, and especially particularly the blood cancer. So genetic disposition plays a key role. And also when I talk about genetic predisposition, I mean to say the genes of the father and the mother. So Ayurveda says that the prakriti of an individual
and the bija,
bija. So the prakriti is decided based on the bija, like as you said. So Shukra and Shonita. So when that sanyoga happens at that time, exactly, the sperm and the ova. So exactly. So based on that, so whatever defects are present in that gene, prakriti, they are embedded in this bija, and it takes the form of a fetus. So it is already pre-decided, or it is already has led to the consequences. But now at certain age, it gets diagnosed. So what I recommend is, I recommend parents to who are, want to get a very healthy and healthy child, or have a very healthy child, so they can adopt a very healthy lifestyle from now itself, an ayurvedic way of life. Because see, once it is diagnosed, we cannot undo it. It's a very difficult process. So as you said, it's a sanyoga which happens between a sperm and a ova, and it happens, yes, it happens invisibly. We really don't know, like scientifically also we just imagine this might happen, but we cannot exactly pinpoint that this is the point, this is the defect. So but the outcome is seen in the children, right? So there we can recommend ayurvedic lifestyle. And coming to your second point,
so that I would like to also wanted to ask you, what percentage do you think environment in today's time is affecting the children apart from the genetic predisposition?
Yes, definitely, Dr. Sharma. Because as much as genetic predisposition affects, so much is the effect of the environment. So now, as you can see, there's a much westernization. There is much gadgets around us. They're every time releasing radiations around us. We're exposed to so many types of chemicals every now and then. Even we use so many high grade chemicals. Even the chappals we wear, they contain very toxic. So it's all around us. I really cannot pinpoint and say, but I would like to definitely highlight, like we can lead a very organic and a very natural way of life, where we use very less chemical, or for anything. Even our food has so many chemicals, to point out. So it has so many preservatives. Even the shampoos the soaps we use, the hand wash we use, everything is based on chemicals. So it's very difficult to separate ourselves from the chemicals, and so is the food which is grown. So even the fertilizers also
Right.
have certain chemicals. So they are transported through the food which the mother consumes, and that is again transported to the fetus. So that affects at that level, right? So we have to be
Right.
very careful about all these things.
Okay. Before we wind up, what are the 3 tips that you would like to give for the children as well as for general people for the prevention of this cancer?
Yes, definitely. Dr. Sharma, first thing is I would like to recommend the Ayurvedic way of lifestyle. So here you spoke about Swasthasya Swasthya Rakshanam. So
True.
those who are not affected by any type of illness. So here what we can do is to prevent any such episodes in the future, we can adopt a very Ayurvedic lifestyle. So by what I mean by very Ayurvedic lifestyle is the Palana of Dinacharya, Rutucharya,
Right.
Ratricharya, and Sadvrita.
Means daily
So I
regime,
will just
seasonal regime, and the night sleeping pattern as well as the day patterns of life, natural cycles of life. Right.
yes, Sadvrita
True.
is also plays an important role
Health
along
and
with Dinacharya
hygiene.
and Rutucharya.
Right,
Yes,
right,
yes.
right. We have our guest, Dr. Reshma Shah. Good afternoon, Dr. Reshma, and we are honored to have you at this platform of Healing Our Earth. I would like if you can just give some comments on what we have been discussing about leukemia in the children, where the rising cases of leukemia are being found, and what, as per your perspective, is the reason behind these kind of cases found in children nowadays. Over to you, Dr. Reshma.
Hello, hi. Thank you so much for having me. That was a brilliant talk, so interesting. And yeah, I mean, I think we're not only seeing it in children, we're also seeing in adults that the lifetime risk is now higher. It's 1 in 2 lifetime risk of cancer. In adults, I don't know the exact number for children, but I completely agree with what Dr. Amrita was saying, that, there are so many environmental lifestyle consequences of more pollution. So there's a lot more smoke in our air. Obesity, we know, is a really strong link to cancer as well. We know that the fat cells have more something called estrogen, and that can cause more growth hormone, which increases your risk of having cancer. And that's why that childhood is so important to try and tackle it. We're seeing more processed food in children's diet rather than vegetarian home cooked food. All of these things are contributing factors, which Dr. Amrita touched on as well.
Right. We have Anil Kumar as well. Kindly, please, your comments, sir.
Thank you, Dr. Amrita, the episode host. Dr. Reshma Shah, welcome to Healing Our Earth family, and Dr. Amrita in India. Good presentation. Maybe we can use it a bit later, and we'll go a bit slow so that people can grasp it. So stay down, and we need to discuss further. Dr. Reshma Shah, can you please make your camera landscape rather than portrait, so we can capture a better...
Like this way? Is that better?
Yes, perfect.
Yes,
That's beautiful. And Dr. Amrita, go ahead and let's introduce Dr. Reshma Shah.
Sure. Global Namaste, Dr. Reshma. Again, I welcome you to this platform. And before we move further, I would like to introduce our viewers to her. Dr. Shah is currently a general practitioner at Hackney, London, with a special interest in early cancer diagnosis. Dr. Shah works at Royal London Hospital at the Rapid Oncology Diagnostic Clinic. This is a clinic which is for the patients with vague symptoms that could indicate cancer. And today she'll be sharing with us cancer screening and early diagnosis. Thank you. Over to you, Dr. Reshma. Please give us the wisdom of how important it is to screen the cancer early and how important is the diagnostic part where we can catch up cancer. Over to you. Thank you.
Thank you so much. So yeah, what I'll do today, I don't have a presentation, but I'll just talk to everyone. Is I'll talk a little bit about all the screening programs that are available in the NHS. And then I'm going to talk about 2 other screening programs which aren't in the NHS, but really go through the symptoms. So that's prostate and lung, because if you have these symptoms, it's really important to talk to your GP and actually, you know, get some more information, get some more tests.
True.
So yeah, so we're going to start off with screening. So why do we do screening? What's the point of it? So screening is really important because when you're feeling healthy, you might not know that there's something going wrong in your body. And the whole point of screening is by doing these very simple tests every few years, they can pick up the very, very early signs of potentially a cancer, or for example, in cervical cancer, it could be the pre-early cancerous cells. And it's really important that when you engage with these programs and you do regular testing, it means that you would have the chance for an early diagnosis. And the earlier that you have a diagnosis in cancer, the better your outcomes are, the more treatment options are there. You know, your life, your mortality, the number of years that you would survive after you've been diagnosed, you know, would get longer and longer the earlier you get a cancer that's diagnosed. And these are big population screening programs, so it means it's offered to everyone in the whole country, and you know, it's completely fair and it's for everyone. So there's, you know, no discrimination, nothing like that. So in the NHS, you know, we have 3 cancer screening programs. We screen for cervical cancer, we screen for breast cancer, and we screen for bowel cancer. And the important thing to remember is that it's there in the age groups that you know, the people will benefit from it the most. So it's not offered to all ages, it's not offered from when you're born, but it's in the age groups where people often get these cancers. So that's why it's important to engage at the right time. But like any test in medicine, you know, nothing's black and white, nothing's 100%, and the screening tests are not 100%, but with good understanding of, you know, what cancers we're talking about, with a good understanding of symptoms, you know, it's important to use that test as a tool in part of your general health. So just a bit about cancer in the UK. So the top 4 cancers are, number 1 is breast cancer, prostate cancer, lung cancer, and bowel cancer. And that makes up about 50%, almost 50% of all the cancers that are diagnosed in the UK. So we'll start off by the first screening program, which is the cervical cancer screening program. So that is the neck of the womb. So that's what's called the cervix. And it's offered to all women from the age of 25 to 64. And it's in the UK, it's, you know, it's the 14th most common cancer. But when you look at countries that don't have a screening program, so for example, in South Asia, it's the 4th biggest cancer killer. So that's why these screening programs are really important. It saves, you know, thousands, hundreds, millions of lives if you engage in it properly. So what happens when you have a cervical test? So from 6 months before your 25th birthday, and then every 3 years, you'll be invited by the NHS to have a smear test. You'll probably receive a letter from your post, or your GP might send you a text to invite you to come to have a screen. And it's called a pap smear or a smear test. And what they do, it is, you know, can be slightly uncomfortable, but it doesn't last very long. The doctor or the nurse would use something called a speculum. They would use it to open up via the vagina, look at the neck of the womb, and they would use a brush to take some samples of cells, and then those cells get sent off to laboratory, and then within about 6 weeks' time you would get a result. And those tests are looking to see 2 things. One, if the cells that the sample has changed at all, and they're looking for a virus, because what we know is HPV, which is a human papillomavirus, is very closely linked with cervical cancer. And often, it's a very common virus. Lots of people have it. And for most people, your body can get rid of it in about 2 years' time. But if your body isn't able to get rid of it, or when you've had your smear test, it's picked up, then that would be a test that would be positive, and you'd get sent on to have something called colposcopy, which is in a hospital usually, and they would, again, someone else would have another look at this neck of the womb, and they'd either give it a treatment, or they would monitor it for more cells, and then you would have to go back on the screening program. Usually after 1 year you'd be called in to make sure that the HPV has completely cleared. If it's normal, negative result, then you would go back onto the routine screening program, and that would be every 3 years. And HPV, we probably will be seeing a lot less of it in the future years, because now there's a vaccination. So the HPV vaccination, which is offered to all children in the UK, boys and girls, aged 12 and 13. So if you have got children and they're approaching that age, really important, get your children vaccinated, because in the end, it completely reduces their risk of things like cervical cancer, and also lots of other cancers that are related to HPV, things like anal cancer, penile cancer. So that whole area, in essence, you're protecting once you get your child protected with that smear. In different parts of England, they're doing trials, so that in the future they would actually just be doing a swab looking at something called HPV, just looking at that virus, because the virus is so closely related to cervical cancer that in the end it will become hopefully just a swab. So more people would probably engage with the smear program, which will be good. Okay, so we'll go to the next screening program, and that is breast cancer. And so that's offered to all women aged 50 to 70, and that's a mammogram. And every 2 to 3 years, again, women would be offered an appointment for a mammogram, where you go to a special mammogram centre, and in essence, it's X-rays that are taken, and that will look at both breasts to detect any kind of abnormal lumps or anything like that. If, as a woman, you should check your breasts every kind of 4 to 5 months regularly. And if you ever do notice a lump, then you shouldn't wait for your screening program. You should go straight to see your GP, so that you can get referred in to, have some more investigations and tests. The third screening program I'm going to talk about is the bowel cancer screening. So there are 2 parts of the bowel cancer screening. So one that hopefully that everyone will know about is when you do the stool test. So that's from age 60 up, 60 to about 74, and you would be sent a home testing kit at home, and it would be a little green bottle, and what you have to do is you have to take a very small sample of your stool and put it into the pot. And what that is looking for is to see if you've got some very, very small particles of blood, because what the evidence suggests is that if you see these very small particles of blood, it could be a sign that there is either something like a polyp, or it could be a very early bowel cancer. And so again, if you're picking it up, that means you can potentially have, quick diagnostics, early diagnosis, good treatment, early treatment, and your outcomes are all much better. Now, lots of you might have noticed blood in your stools before, and there are lots of other reasons that aren't bowel cancer that can cause you to have blood in your stool, things like hemorrhoids, piles, which is very common. But it's always important that your GP or another doctor or clinician has actually diagnosed you with that. And it's also important to know that you could have piles and hemorrhoids, and you can also have bowel cancer. And you shouldn't just think, oh, I've got piles, so I'm not going to worry about doing this bowel cancer screening, because the piles is looking at the, just outside the anal passage, so it's kind of fresh blood, often on the tissue. But the bowel cancer is tracking the blood from much higher up in the gut, and that's the important, differentiation. So important that, you know, whatever diagnosis you have, you still engage really well. And if they find, you know, any small particles of blood in this sample, then you'll be invited in to do something called a colonoscopy. And that is a camera test from the back passage, looking at the whole bowel, you know, the large bowel and parts of the small bowel, looking to see if there is any kind of suspicious lesions or any polyps. And important to remember, you know, in the UK, it's the 4th most common cancer, and as you get older, your chances of having bowel cancer also increases. So it's really important because screening can really help you identify at an early age. Now, the 2 other cancers that screening programs I wanted to talk to are prostate cancer and lung cancer. And the reason I wanted to talk about it is because other countries in the world offer these screening programs, and we are thinking about doing it in the NHS. You know, there's lots of talk about it, but until it's kind of implemented, I think it's really important that everyone knows what are the signs to look out for, so you feel empowered to go and talk to your GP about it. So the first one is prostate cancer, and if you notice as a man any kind of different symptoms down below, that might be causing pressure symptoms, and I'll go through them in a bit more detail, especially once you're the age of 50. It's really important to go and talk to your GP about them. It could be a very common condition, which is when the prostate just becomes larger, which is common with age, and that can cause pressure symptoms. But it's important just to make sure you go in to see your GP and have this blood test, which is called PSA, because that will give us a better indicator if it could be, you know, something sinister like a prostate cancer or something completely benign like a large prostate. So the signs that you need to look out for, the symptoms include, so if you feel like you need to pass urine more often in the day or at night, if you feel like you're rushing and you have to really quickly get to the toilet, if you find it hard to start passing urine, so you feel, you know, hesitancy, if you have to strain, or it takes a very long time, if your flow has changed, or the feeling that, you know, you've passed urine but your bladder still isn't empty, or if you ever see blood in your urine or blood in the semen, you know, definitely go straight away and see your go and see your doctor to get some more tests for them. The next one I want to talk about is lung cancer. So in different parts of London at the moment, they are doing a trial to start screening people for lung cancer, and that screening program is actually only offered to people who have a smoking history. So if you've smoked 20 cigarettes for 20 years, then in America, you know, people get screened from the age of 50 onwards to pick up early signs of lung cancer. In the UK, they're running it as a trial in different parts of England and in London, and the criteria to enter this again is if you've had a smoking history, then you would be invited to have these screening tests for lung cancer. And as more funding in the NHS comes through, that screening program will get rolled out. But it's really important that, you know, if you've ever had a history of smoking, but that you you know, you talk to your GP if you've got any of these symptoms. So they would include coughing up blood, if you have kind of recurrent chest infections that just keep coming and you're just not getting better from them, a cough that is getting worse, you know, you should always talk to your GP about that, especially if it's been more than, you know, 3 to 6 weeks. If you get any pain when you're breathing, when you're coughing, if you're feeling extremely short of breath, lack of energy, tiredness, weight loss, all of these could indicate, you know, something that's going on in your lungs. And there are kind of other signs as well. Some of them might overlap with other conditions people have, like things like asthma. So you might notice that you're wheezing a bit more, that you've got swelling in your face, your neck, your voice has changed like a hoarse voice. Again, they're all things that should trigger you to go and see your GP. So they're the kind of main cancers that I wanted to talk about today. So the 3 that are on the NHS, and the other 2 just to really highlight that if you have any of these symptoms, if especially in the age bracket and you've got a smoking history, you must talk to your GP about those symptoms. Yeah, that's me.
That's so valuable. Thank you so much. This is amazing, and it is so important as well. because early screening will lead to the protection and prevention. And therefore, Dr. Reshma, can you
Yeah,
still hear us? Yeah.
I can. Yeah, I think.
Yeah. Yeah, your video is blurred, just that.
Yeah, I'm not
Um,
sure. Sorry.
Yes,
Uh,
we can hear you. We can.
Dr. Reshma, you were
yeah,
born lopsided, so if you could
upside. Okay, let me.
place yourself onto landscape, please. That's perfect now.
Better. Okay.
Yes, over to you, Dr. Amrita. Thank you.
Thank you. Thank you, Neilji. Thank you so much. So, Dr. Reshma, that was very insightful, in fact, and to know about this. So, as you said, these kind of screening programs, which are regularly available at NHS, but there are so many countries. And because through this global channel of ours at Healing Our Earth, more than 100 countries are listening to us probably. And many people must be really aware and must have been educated with what to do. What kind of other tips do you have for general people living across the globe, of what other things they could have, like they can use where the GP availability is not there? Because sometimes in some countries, there's so many long queues of standing and they cannot approach the doctor so early. So in that case, what kind of advice do you have that can be started up before they reach to the GP?
Do you mean in terms of a screening program or just general cancer advice?
In general, before they
Okay.
reach to the screening, because sometimes
Yeah.
screening program becomes too late. Most of the time, what we see in many countries is that before they go for screening, it becomes too late for an individual to know that, and it becomes a matter of a big stake where around 90% of the body is already with the cancer cells, and you are left with no option. So
Yeah.
in that case, what all other things do you advise people for?
So I get, a lot, they say a lot of about 20 to 40% of cancer is preventable through lifestyle. So, one of the things we talked about is getting vaccinated appropriately. So, when, getting at age 12 to 13, getting the vaccination. In a lot of these hot countries, thinking about sun protection, because we know that, sun rays, even in Asian skin, can affect skin cancers. So really important to stay out of the sun at peak times. Alcohol and smoking are the biggest things, lifestyle things that people can do to prevent cancer. The evidence is very strong for smoking, not only primary smoking, but also secondary smoking. So living close to people, smoking the air, sharing a room, all of these things can have an impact. We're seeing more and more evidence about the impact of pollution as well. But unfortunately, if we live in the city like we do here in London, there's less that you can do. But often governments are trying to have strategies where there's less pedestrian friendly streets and things like that, but of course in some countries that's not possible. Alcohol, there is less and less evidence. There's more and more evidence that there are very little benefits of alcohol, especially when we think about cancer. Every additional drink, every additional unit correlates to an increased risk in cancer now. And then eating well, and I think Dr. Amrita talked about that, is that in our entire food supply chain, the point of fertilizers to the soil, to the moment it's preserved and it comes to the shops and into our stomachs, there are lots of carcinogens and things like that we wouldn't necessarily know about, but trying to eat as healthy as possible, fresh fruit and vegetables, reducing red meat consumption, processed meat especially, will all benefit people's health in general. And then staying healthy, exercise, reducing your weight, being the correct BMI. These are kind of really important lifestyle factors. But really, I guess the problem with screening is that it does really depend on diagnostics. So if you can and you have the ability and the facility to get regularly tested, to have a routine blood test and part of these smear tests and things like that, then it's if you can access it, then you should have it at regular intervals. Every kind of 2 to 3 years is important in whichever country you are.
Right. And in most of the countries, like in our country, in India as well, we see, and many other countries, mouth cancer is also very common. So what are the common signs and symptoms of mouth cancer, and what are the reasons basically of mouth cancer?
Yeah, so oral cancer, again, it's the most common cause is one, HPV, but also smoking, really common cause. And you see high rates of smoking in a lot of Asian countries. So the things that you would, the most important sign is really things like an ulcer in the mouth that hasn't healed after 3 to 4 weeks. And if you notice any changes, kind of a thick white coat on the tongue or in the upper palate, again, anything that's changing in the mouth, if your voice becomes sore, if you notice swelling in your neck, all of these are, really important signs that you go and speak to your doctor. Anything that's unusual, from when you're feeling healthy and normal, you should always, talk to a health professional about.
All right. And what are the basic signs of skin cancer if person has?
Yeah, so there's different types of skin cancer. The one that's most commonly related to sunlight is a malignant melanoma. And as people get older, we see things called BCC, basal cell carcinoma. So with skin cancer, what you're looking for is moles, and you're looking for a mole that looks different. So when we traditionally got trained, it's called the ugly duckling sign. So some people have lots of moles in their body, but you're looking for dark mole that looks different to all the other moles, or you're looking for a mole that has changed. So it's changed in size, it's changed in shape, it's changed in color, sometimes has 2 different shades of brown in that mole. And if they're itchy or bleeding, then they should trigger you to go and see your GP for a referral, or straight to see a dermatologist, because often they'll need to look with a special lens to see what is going on at the deeper skin level. And with age, as you get older, your chance of skin cancers like squamous cell and basal cell become higher, and often that can be things like little ulcers near the eye or around the nose, or around the lips. Ears are all common places. And again, any type of ulcering in the skin, you should go and see your GP about, or your dermatologist.
Right. And because we see weight loss as one of the common symptoms in most of the time, the cancers. So what are the common cancers in which weight loss will be appreciably seen despite we cannot see the clinical features?
So part of my work that I do in the hospital is in this early cancer diagnosis clinic is really about patients who have vague symptoms. And the vague symptoms include feeling very exhausted and tired, having weight loss, pains that aren't explained, ongoing pain, especially in the tummy, abdominal pain, things like that. Sometimes we'll get referrals in from GPs who have done a set of blood tests and they look abnormal, and that's why they've been referred. But really, it's these vague symptoms that are, you're not sure, but you're feeling really exhausted, you're feeling really tired, you're losing weight and you're not sure why. This will be, something, not always cancer, but some significant medical diagnosis might be happening. So either way, it's important to see a clinician quickly.
Right. And so apart from these common symptoms of that, with the age group, do you think like there are any other particular symptoms, as Dr. Amrita also mentioned in her talk about the children with leukemias? So, and as you mentioned that HPVs are very common in a particular age group, especially the youngsters, and the cervix cancer, which is pretty common, or penile cancer can be very common. So in all those cases, basically, can you categorize and tell us, like in this age group, what kind of screenings is important in a particular age group, middle age group, what screenings are important, and at old age group, what kind of screenings are important?
Yeah, sure. So from age 25, women should start engaging in the cervical screening program. From age 50, women should start engaging in the breast screening program and bowel screening program. And for men, prostate, start talking to, if you notice any symptoms from age 50 plus, you want to start thinking about screening programs. Yeah, for those.
Okay. So And when people go for, so people basically have a general fear about these screening programs. You know, cancer word itself is a very deadly word, because once people hear about it, they think the life has finished and everything is over. So what message would you like to give people in general so that they can be quite optimistic for the approach, as well as not only for themselves, and bring public awareness for the people around, for that, for early diagnosis and protecting themselves?
Yeah, so I would say the bowel screening program isn't, uncomfortable at all. It's just getting a sample of your poo, of your stool, into a pot. So it's not uncomfortable at all. But you're right, the breast screening and the cervical screening, it can be uncomfortable, but it's a very short amount of time that you feel uncomfortable for, a few minutes at most, while the procedure is taking place. And it's those few minutes of uncomfort that might, you might be that one patient that something's picked up on, and it could be the thing that saves your life, or gives you 5 or 10 extra years by having an early diagnosis. So it's a few minutes of discomfort at the most. And when you're in the process, you can always say to them, and you're always in control, that if it's too uncomfortable, you can always say stop, and try again another time when you're feeling a bit more ready for it. Some of my patients who find smears very uncomfortable, I say to them, take some painkillers before you come, half an hour before you come for the appointment. Simple paracetamol or ibuprofen, if you can take that, will make the procedure a lot more comfortable for you if you're very uncomfortable in that area. So yeah.
That's good. Yeah, thank you. And we have a question from Meeta from UK, that everybody above 25 years of age should go for the smear test. However, I wonder, is the smear test recommended for both sexually active and non-sexually active women?
That's a really good question. And the recommendation is still to have, even if you're not sexually active, even if you're not having penetrative sexual intercourse, you should still have regular cervical screening, because the HPV virus can be passed through very close skin-to-skin contact. So it doesn't have, it doesn't have to be penetrative sex that causes you to get HPV. So the NHS recommendation is still to engage in those programs. Yeah.
That puts up a very important question, because so many people are diagnosed with HPV, whether they have benign cancer or they have malignancy. So what are the common causes of HPV, like how it transmits? Just a brief.
Yeah, so it transmits through very close contact. Okay. So very close skin-to-skin contact. And you can also get it through penetrative sex, but it doesn't have to be only through that way. You can have had the virus. You could, have married one partner, and you could have had it for many years and not known. So it's still important, whatever your history is to engage with the screening program.
That puts up one more question in my mind. Do you think, what's your opinion, that every person, like any woman who has HPV, will definitely develop a malignancy in one way or the other? No, not necessarily.
No. So with HPV, for most people, the body will be able to get, shed it by maximum 2 years. But for some people, they will hold on to the virus. But what we know is almost all cases of cervical cancer are linked to HPV, which is why future they will just be doing swabs. But right now we haven't got that technology, and we have to do smear tests, which is taking a brush to take the sampling of the cells. But almost all cases are linked to HPV. So it is important. And HPV, there are different numbers of HPV, and they can cause other different cancers as well. So different types of head and neck cancer, anal cancer, penile cancer, cervical cancer. So the vaccination is going to be the biggest way to prevent this going forward for our younger generations. So that's brilliant. But for those of us, my age group, for example, who haven't had the chance to be vaccinated, it's important that we have the smear regularly.
Okay, thank you. Thank you so much for lovely information. Please stay around. We have another guest waiting for us, and your inputs and comments would be really appreciated. Dr. Reshma Shah, thank you so much. Thank you.
Thank
Before we move to Dr. Mahesh Kulkarni, I would just wind up that HPV testing is very important. Breast examination by yourself is also very important. If you feel any symptoms after 50 years of age and you are a male with prostate symptoms of urine incontinencies or changes in the urine, again, see your doctors. If any changes in their bowel habits and stuff, again, see your GP. So all these things are very important. Global namaste to you, Dr. Mahesh Kulkarni. We are very pleased to have you at our Healing Our Earth platform. So we have Dr. Mahesh Kulkarni from India, and we'll be shortly having his presentation. Before the presentation begins or his talk begins, allow me to have his short introduction. Dr. Kulkarni is well-known Ayurveda practitioner specialized in Panchabhatik Chikitsa, which is a 5-elemental therapy method for last 34 years. He is discipline of Brihatray Ratna Vedya Datta Shastri. He specialized in Ras Aushadhi Nirman, like Swarna Bhasma, the gold medicine. Dr. Kulkarni frequently writes in daily newspaper papers and magazines, and also in the social media platform about the health in Ayurvedic perspective. He was invited for Ayurveda lecture series in San Diego, USA, for his with his wife, Dr. Renuka Kulkarni. That series well received and appreciated by all the audience. Thank you very much for coming to that platform of Healing Our Earth. Dr. Kulkarni, so what do you have for us today?
Yes. Namaste all, and global namaste for all. Myself, Dr. Mahesh Kulkarni, practicing 34 years. Just you have introduced us. And thank you, Dr. Amrita, for introducing me. And thank you, Dr. Neil, to giving opportunity for me on this platform. And today's our topic is, just a moment, we'll share screen.
Yeah, today you are talking about leukemia, I think, through Panchabhatik effects. Yes.
Yes.
Okay.
Yes.
Okay. So that'll be an interesting thing to know. Yes.
Yes.
All right. Maybe
now,
have full
can you
screen.
see the screen?
Yeah, please
Yes.
full screen, please. Yes, that's good.
Okay.
Please, over to you, sir. Thank you.
Yes, yes. Thank you. Thank you all. This is our God, Panduranga, where I reside in Pandharpur, Maharashtra. So first, I will pray for Guru Brahma, Guru Vishnu, Guru Deyo Maheshwara, Guru Sakshat Parabrahma, Tasmai Shri Gurave Namaha. Today's our topic is Panchabhatik aspect of chronic myelogenous leukemia, a case study. First, I will take opportunity of this platform to introduce my Guru and my Guru Parampara, Brihatray Ratna Vedya Atmaram Vaman Datar Shastri. In short, I will introduce him. Late Vaidyaraj Atmaram Vaman Datar Shastri, a scholar of all Ayurveda Samhitas, who was blessed with the divine grace of Saint Jnaneshwar Mauli, and is the pioneer of this Panchabhatik Chikitsa Pranali. He believes Tridoshas originate from Panchamahabhutas, considering this as the base. Respected Datar Shastriji laid the foundation of Panchamahabhutik Chikitsa Pranali, which of course suggests that he had deep knowledge about Tridoshas and he researched in further depth. His basic main highlights of his Panchabhatik Chikitsa Pranali, I will shed light on this. His special technique was the Udara Parikshan. He has developed a typical system of Udara Parikshan, that is, he nominates Udara Parikshan is Agni Samstha. He was believed that liver, spleen, and kidney, these are main affected by Agni, and Agni is represented by these three organs. Also, he invented his own Nada Pariksha, that is novel method of abdominal percussion. He his one more specialty is that he considered previous childhood diseases such as chickenpox and measles in latest diagnosis of disease. Also, he is famous and he was awarded Ratna for his Amlak Shara Siddhanta. It is interesting to know that Amlak Shara Siddhanta, he derived it Amlak Shara Siddhanta from one shloka only from Madatya Chikitsa from Charak Samhita. That shloka was Ksharohiyati Madhuryam Shighram Amlopa Samhita. And on that single note, he developed all his basics, all his medicines on these Amla and Kshara Dharma. And he got result very immensely. Also, his specialty is in Buddhindriya, that means brain. He always emphasized about the Buddhindriya Chikitsa in finalizing the treatment protocol. Also, his one of the most popular and he always emphasized about the manufacturing of various classical medicines by his own. And he also was very keen that all his disciples will make all their medicines by their own. And that will we always follow him about the medicines. And it gives this medicine gives the confidence to make results, and also it reduces the dosage of medicines in the practice. So Datar Shastri was conferred with Brihat Ratna Award by AVP Coimbatore. Next slide. So now we are going to our main topic. Yeah. But before going to our main leukemia case, we will see the basics about Panchabhuta. It is Ayurveda always believe that man is a miniature of nature, or yatha pinde tatha brahmande, yeah, brahmande tatha pinde. So these primordial elements like Panchamabhuta that are always present in the outer universe, as well as they are present in our body. So Prithvi, Aap, Tej, Vayu, and Akash. These are basic five elements which contributes in the development of universe as well as development of our human body. And when any imbalance gets in this Mahabhuta's equilibrium, then the disease get forms. So first we will see the Prithvi, that is Earth Mahabhuta. We will talk about the basics of Prithvi Mahabhuta. It is a solid state of matter. It gives stability, that's prerequisite for leading a healthy life. It gives permanence, rigidity. In our human body, we will see that rigidity, stability, and permanence in bones, teeth in human body symbolize the earth. Also, it is this Prithvi Mahabhut has the special attribute is Gandha, that is smell guna. So it represents our nose, or our Ghanendriya represents this Gandha guna in our human body. Now we'll go to next Mahabhut, that is Apa Mahabhut, that is water element. What are the basics of Jala Mahabhut? Its basic guna is fluidity. It provides a medium for binding, moistness, gives the feeling of satisfaction, blood, lymph, sweat. These are the main representative of Apa Mahabhuta in our human body. It maintains moisture in the body. This always we will see in our, when dehydration state occurs in any patient, we'll see that his skin and his internal organs get dry, And when it is replenished by water or fluid, it gets regain its moisture. This is a always seen example. Also, Apo Mahavut soften the stool. It helps in bonding of two dry elements. It is always observed and experienced in our outer nature as well as our body. Rasa guna or taste is the prime characteristics or guna of Apo Mahavut, and it represented by our tongue, Jiva. Third Mahavut, which is very important in our journey, it is Teja Mahavut, that is fire element. In the universe, sun represents this fire element, as well as our digestive fire inside the body represents this Teja Mahavut in our body. Rupa is the main attribute of this Teja Mahavut. We can visualize with the help of this element that we can see, we can acknowledge the other person's aura, or say it helps in by Teja Mahavuta. It is useful for conversion of macronutrients into micronutrients. Also, Teja Mahavuta is responsible for digestion. It is also responsible for digestion as in human body, as well as it is responsible for conversion in nature. It is responsible for aura, complexion, glow, glare, bright appearance of human body, vital power, etc. It is the main key factor in 5 Mahabhutas, and all balance is in 4 Mahabhutas. It gives equilibrium in by help of Teja Mahabhuta. Next Mahabhuta is also very important. It is Vayu Mahabhuta. We cannot see direct this Vayu Mahabhuta or direct, but we can feel this element. Movement is the most characteristic feature. Vayu Tantra Yantradhara. This is described in our text. That means Vayu is all the characteristics, all binded by this momentum and Gatitmak Kriya in our body. This always we can see in Vayu Mahavata, that motion of clouds in sky, cool breeze during chilly morning in our universe. It helps in division and multiplication of cells. There is one shloka that Pitta and Kapha dosha are immobile in nature, but only due to Vayu or Vata Maha, they can move from one place to another in our body. Also, it is a better example we can see that in when embryo is developed, that zygote, it is developed into morula, it is also developed to blastula, and so on. It is to mature garbha. This development occurs with the help of Vayu, that is Vata Mahabhuta. And next, final and fifth element is the Akash. Akasho Apratihata. That is means Akash. It is always available in all universe. It gives space. That means the planet, moon, earth, sun accommodates in the space. That is Akasha Mahabhuta. It corresponds to empty space or cavities inside the body. It is responsible for free flow of nutrients as well as rasa rakta from the channels, that is srotasa. Helps in creating space between the cells. Its main guna or main attribute is the Shabda guna. It is Akasha Mahabhuta's main characteristics. Also, we can see here on the slide, dosha is the macro concept. Tridosha, that we always we are familiar with Vata Pitta Kapha. When Ayurveda is there, then Vata Pitta Kapha is there. We always familiar with these terms. But Panchamahuta is the very micro concept, and it is a very precise way of thinking to lead to a healthy life or lead to a perfect diagnosis. Here we can see in this slide, the Vata dosha is comprised of Panchamahuta, Akash, Svayu. Pitta dosha is comprised of Jala plus Teja, and Kapha is comprised of Jala plus Prithvi. So, in the precise leading of healthy life or a precise way to diagnose is to what we think about Panchamahuta. Yes, now this is the final principles of Panchavati Chikitsa. Here you see Prithvi Jala is balanced with Teja. If Teja Mahabhut gets imbalanced, Prithvi Jala gets imbalanced, and also it imbalances Vayu Akash. So when we have to treat one of these or all, we have to treat Teja Mahabhuta. So they all can all travel with equilibrium and they give swastha, yani healthy mind and body to a human. Now we will go to our case presentation. This today's topic is CML, that is chronic myelogenous leukemia. One fine morning, his patient came to my clinic. His age was 25 years, he's male. While taking his history, he gives signs and symptoms that you can see in this slide. That is, he developed black reddish patches on his hip and thigh region, all over them. These patches have bruising like pain. He got high fever for continuous 3 days, and he got weight loss in 3 days, that's 6 kg of weight. With him, he brought investigation reports to my clinic, which shows raised WBC levels up to 1 lakh, and also one special report that BCR ABL1 fusion transcript test for CML is positive for T922 type. After detection of CML, he has one midterm 45 days of gap, and he came to my clinic for Ayurveda treatment. While taking his history, he has told me one interesting point, that he has got viper snake 2-3 years ago. In our Panchavati tradition, we take history of his childhood to up to some years ago. And also he gives history about his lifestyle and work. He used to work at farm in extreme hot temperatures. First, snake bite also vitiates Teja Mahabhuta. And also second reason is he works in farm at hot temperatures continuously. This also got disturbed Teja Mahabhuta in his body. So here we are, this chart shows Ayurvedic diagnosis of him. Visha, that is venom, got toxic effect on his rasa and rakta dhatu. So, which vitiated rakta dhatu, which was all over body, got vitiated, and also due to prolonged exposure to sun, it got always doubled its vitiation. It leads to its imbalance in Teja Mahabhuta. So here the process occurs in short. First, his Rakta Dhatu was vitiated, which leads to Pitta vitiation, because Rakta and Pitta, they are always with each other. So these two leads to Teja Mahabhuta Vikruti in his body. And Teja Mahabhuta Vikruti got, as you see, when Agni is there, imbalance or imperfection got in Jala and Prithvi Mahabhuta. Here it is, it occurs same. Teja Mahabhuta Vikruti leads to imbalance in Jala and Prithvi Mahabhuta. Also, imbalance in Prithvi Mahavuta leads to lack of sthairya. So he got weight loss, is 6 kg in 3 days to 4 days. Also, in diagnostic method, we have Udara Parikshan, that is abdominal examination, which is first palpation. His spleen was palpated with his heart, which resembles the Prithvi Mahavuta Vikruti. It also feels very hot in sparsha, which is also leads to Teja Mahavuta Vikruti. Also, his liver was involved, but it also shows this temperature raised. So now, considering these factors, Teja Mahavuta and Vikruti in Jala and Prithvi, first we have to treat the increased Agni. In our uh, in our outer nature, we always see that if there is Agni, it is with fire, which is not required. We calm down that Agni by pouring his water or some soil on that. Same principle is used in treatment of this. So this increased Agni was used to balance. We use Prithvi and Jala dominant medicine, Vidrumakitta, which is our traditional medicine in Panchabhuta Chikitsa Pranali, which was invented by Vaidya Datar Shastri. Also, second factor is, so we have to neutralize that toxic effect. As it is, we see that it was 2 years to 3 years ago, but the effects of that toxic venom was seen on Rasa and Rakta Dhatu. So the Vishay Prativisham Deyam Sutra, here we apply. So in small quantity, in very micro quantity, we have to use purified Visha. That is, we always use Vatsanabha, and which Vatsanabha Kalpa was Tribhun Kirti. Our Panchavati tradition here uses Tribhun Kirti plus Girij, which is called as Jvaragnayo. We have given him for 4 weeks. And when his Agni shows signs of normalization, his skin glows, his digestive tract was on track, Jvaragnayo was discontinued. Now, for long-term treatment, for 8 to 10 months, the Rajniyo medicine is used. It is also our Panchavati traditional medicine, which comprises of Rajani, that means Haridra, plus Girija, and which are Bhavir, which have triturated with Haridra Kwatha for 7 days. So it is Rajniyo. It helps to normalize the Rakta Dhatu. It helps to make Agni normalization in Rakta Dhatu. And it, as Agni gets normalized, the imbalance of the Mahabhuta will get balanced. Also, for vitiated Vayu Mahabhuta, which is all over body, that is Sparsha Guna. So Snehan, here is, we have suggested him, which is of Nimbu Siddha Taila, that is lemon juice, which has prepared in oil, so to apply to all over body. So here we are at the final results was very impressive. He was very response from his body was very courageous. His bruising pain reduced after 6 months of treatment. Patches were completely vanished after 1 year of treatment. And for prolonged period, Rasayan Chikitsa continued after, so there will be no possibility of recurrence. But this Rasayan Chikitsa is now is still continued for him. here are his reports, which we came from for him. It was before reports. You can see here, and also after our treatment, these are recent reports, and transcript detected was not detected, and also available observed copies were 15,900. It is very important and it is helpful for us. Namaste. Thank you for patience.
Thank you very much, Dr. Mahesh Kulkarni. That was a very informative and very nice presentation, in fact, of a case study. So I have a question for you in fact, that's a marvelous presentation based upon the Panchabhatik concept and how, in a simplified form, you explain the 5 elements and how these 5 elements play a role, in which the fire element has a major role to play in every individual's body. That is the governing factor which will be affecting your fire, affects your water and earth element. It also affects your air and space element. So to balance them is so important. So apart from this case, like this patient of this kind of a presentation, what is the mode of treatment for the patients with general leukemia at your place?
There is no generalization in our science, Ayurveda. Ayurveda is very specific, that is person-specific medicine treatment.
Right.
It helps to eliminate disease. Also, it helps to get healthy state of body and mind.
True.
So we cannot generalize this treatment protocol to any leukemia patient, because it is very personalized medicine. So we can take very person-to-person case history, and also we can then chalk out the treatment plan for them. But my case experience was limited to this. We can also, when there is another pattern of leukemia, or then another pattern of that, treatment protocol will be different.
Okay. And what kind of Rasayan therapy did you use for this patient? And in general, what are your recommendations for the Rasayan therapy? Rasayan therapy, to tell our viewers, is like the rejuvenators that are used. So basically, what is that?
Yes. For Rasayan treatment, I use here, after long term of Rajni Yoga, I use here Swarna Bhasma.
Right.
With some Madhura Pak, that means Kushmanda Valeha.
Right.
To get strengthen his body, to get Bala Vardhan of that patient.
Right.
And then it is continuous still today. But now here in India, it is summer season. So I have to discontinue Swarna Bhasma for 3 weeks. And I was up to Vidromekitten again for Rasa Rakta Dhatu Prasadam. And after rainy season, we will again continue on Swarna Bhasma. But I have to watch this patient for minimum 1 year. So we have, here we say, you have seen the reports after 1 year.
Yes, sir.
So we have to follow this protocol for
okay. Thank you very much, Dr. Mahesh. Thank you for your contribution. Please stay around. Your comments as well as your opinions are much appreciated. And we have a question for you as well. We'll take over in a couple of moments. Please stay around. And let's welcome Dr. Swapnil Mane. Global Namaste, Dr. Swapnil Mane from Mumbai. And Dr. Swapnil, we are good to see you at the platform of Healing Our Earth. Most welcome. Dr. Mane, how are you doing?
Yeah, fine. Absolutely fine. Thank you so much for your support and this one. So myself,
yeah, so Dr. Swapnil Mane, before you start up, let me introduce you to our audience of Healing Our Earth. Dr. Mane graduated from the Tata Memorial Hospital, Mumbai, and later joined the hospital as a fellow in gynecology oncology. His commitment towards his profession, his patience, and his clarity to the poor inspired many others like-minded doctors to join him in his noble cause, and his collective initiative resulted in the formation of Dr. Mani Foundation and Research Center in 2011. The primary aim of starting such a national social secular NGO was to provide cancer care and support to those who could not afford it. Prevention is an essential part of our mission. Through public education, clinical preventive services, and research, we strive to reduce the incidence of cancer and serve people who may never be our patients, says Dr. Mane. What a beautiful word. So, Dr. Mane, as I was reading your profile and you have loads of awards in your pocket
Thanks
and
so
loads
much.
about to come, I think so. So what do you have for us today for our viewers?
Yeah, viewers, I would like to say something, say hi. We
Sure.
are a charity organization and we are much concerned with the rural people, rural Indian people and rural community. That is my main motive. When I was working for the Tata Cancer Hospital and the KIM Hospital, Mumbai, till 2010, when I was doing my post-graduation, I seen the plight of the rural patient, the Indians, the rural village and people, very difficult to reach the Mumbai for the further treatment and to go for. And everyone knows, ma'am, doctor, the prevention is better than cure, but very less likely implemented practically. That is my opinion. Yeah,
Yes,
I have seen that
agree.
scenario. And that's why I started a small organization, small cancer hospital, a 30-bed hospital in outskirts of the Maharashtra, the Western Maharashtra, and started practicing for the people. And with the help of the
We have our Neil Kumar. Please, your comments, please, Neilji. Yes.
Dr. Swapnil, welcome to Healing Our Earth.
Yeah, thank you so much, sir.
We're a free community online channel that transmits in several countries. So viewers are actually on social media, website, YouTube, Twitch, Periscope. Dr. Swapnil, I know a bit more about you. You were only 8 years old when you decided that you want to help the humanity. And since the age of 8 years old, you actually made it. You now actually serve sometimes free cancer patients in several parts of India.
Yeah.
What inspired you from the age of 8?
Age of 8 in on 1990, when I was in 5th standard. So when I was residing in the village area, my native place is very small village in outskirts of the Ahmednagar district, rural Maharashtra. That one uncle was died due to the lung cancer, and that was a Godse Kaka, and he could not afford the treatment of the 50,000 rupees for a lung cancer at that time, and the incident has made me nervous and very upset that how we cannot prevent such a precious life lost from the family, and whole family collapsed later on. At that age only, I decided we do. So whatever I will do when I grown up, will become a doctor, and I will do for the society. And I have a lot of faith in the Lord Sai, at Shirdi Sai Baba, Lord Sai.
Right.
And I was graduated, postgraduate, everything through the government quota only. So no expenses anywhere. And since 2011, I started this small venture, small cancer hospital. Now, due to your support and everyone's blessing, that due to the span of the 11 years, we done the 36 research publication. We patented 4 operative techniques for the cancer. And second thing, the 8,000 surgeries free of the cost for the rural patient with the help of various government schemes and donor support. Yeah. And second thing, the prevention is better than cure, that every doctor knows all over the world, but very less likely implemented. I have seen that's why we started the 9 community-based cancer project. Through that, our 9 teams used to go to the villages. They used to screen the patient for cervical cancer, breast cancer in early stages, because in India, there is a transportation issue, the lack of education, lack of awareness, the financial capability, the bad weather, the doctor's availability at the periphery, that all culminate for the late diagnosis of the cancer. That's why the innovative project by our team is to community-based cervical cancer project, community-based health project, community-based travel project. The team is to go to the villages, make the people aware in the regional languages about the cancer, what is cancer, what is the pathophysiology, what are the types, what are the symptoms, how can early catch the cancer on the basis of symptoms or the complaints. And later on, the people come up for the checkup. We do the free scanning for the breast, the pap smear testing or the liquid-based cytology for the cervical cancer, and the rest physical examination, and whatever detected patient is to bring to the hospital for further treatment under various government schemes. And after that, we discharge the patient, and our social worker is to take follow-up. This is a holistic project we adapt here, and it will prove as a very good Silam model of the cancer care, and we would like to replicate in each and every corner of the country. And also,
that's very beautiful. Yeah, that kind of a social work is really remarkable on your part. You have been treating so many people and getting so many blessings, which is required at this time.
Thank you so much.
Specifically, so through the NGO that you are running and through the surgeries that you're doing free of cost, like how do you approach the people? Like how do people come to know about you, and what all kind of basic things do you guide to people about just general cancer awareness through your camps or your NGO program?
Yeah, the two things, ma'am. The people, those got operated from our institute in the span of 12 years. Some people, they known each other or mouth-to-mouth publicity, we can say. They directly come to the hospital to take a cancer care. First thing. Second thing, in community, that is the most important part I suggest. In community, suppose one village we selected for the cancer propaganda or cancer awareness and the free testing. 2 days before, our team is to make the publicity, the handbills, the pamphlets in local regional languages, that such a cancer awareness session is adjusted or is organized here at this day, and this is the timing. Then people used to gather 100, 200, 500 people from that villages and the surrounding catchment area. Our team is to make in the form of PPT, PowerPoint presentation, in the form of images, in the cancer patients' images with their consent. We used to display them and show them what is the cancer, what is the pathophysiology, where it starts, how it starts, what are the known factors contributing. And later on, we used to make what are treatments available for that, what are the research based, and what our organization is doing for the cancer patient, and what are the symptoms we can catch the cancer in early stages. This we emphasize, and patient we used to bring the patient for the for the checkup. Whatever the suspicious patient, we used to do the biopsy, ultrasound, and we stage the patient and we put into the government scheme and we operate the patient. In do you want me to speak about the detail in cancer awareness or what?
Dr. Mane,
yeah,
you are a young person, and what an asset you are to the humanity. May you live long, and you were selected at Healing Our Earth Global Platform for your superb contribution back to the society. Let's go ahead with your favorite subject for today, the cervical cancer awareness. From there on, Dr. Amrita Sharma will engage you with a chit chat. Over to you, Dr. Mane.
Thank you so much. The very much rising incidence for the cervical cancer in India. Yeah, just I would like to share one small PPT for the cervical cancer and the cancer awareness center. Is it okay, ma'am, Dr. Amrita?
Yes, please. Please move.
Yeah, please. Thank you so much. Yeah.
So this is Dr. Mane with his presentation.
Thank you, ma'am. Is it visible to all?
Yes.
Visible, no? Yeah, thank you. So everyone knows the cancer is a disease where the cells grow out of the control, invade, erode, and destroy the normal tissues and forms a lumps basically that we call it as a tumor. There are two types of tumor. One is a simple tumor and one is a malignant tumor or dangerous tumor. Benign tumor is called simple tumor. Tumor cells grow only locally and cannot spread by the invasion or the metastasis. In this case, if you remove that lump or the localized part, patient will be healed. Second time is that is called the cancer or the malignant cell that invade the neighboring tissues, enter the blood vessel, lymphatic, and metastasize to the different sites. And that's why it becomes very difficult to control when it grows, when it is spread to the lateral part. So that is called the malignant tumor or the cancer. Okay. So the early stages, when the initiation of lump or the clumping of the cells, if you see if you catch that disease, that is curable. When it metastases to the different part, that is the lacunae, that is the drawback of this tissue that very difficult to control for this. In later stages, we can do the chemotherapy and radiation for the cancer control. We can, in these cases, we can prolong the life of the patient only and not the cure. Yeah. Next one. These are the stages of the cancer. Stage 1, 2, 3, 4. Stage 1. So generally, the 30% cases are detected in stage 1 and 2, and 70% cases are detected in 3 and 4. There is 70% chances that when patients come to us with the symptoms, with the complaints, they are already in stage 3 and 4. That's why, so early detection makes the crux to treat the cancer, to catch the disease. There are more than 100 types of cancer. Any part of body can be affected by the cancer, and more than 30% of cancer can be cured if detected early and treated adequately. And more than 30% of cancer could be prevented mainly by avoiding the tobacco and allied products and having the healthy life, being physically active and preventing infection that may cause the cancer. Cancer is second most common cause of death worldwide. In India, 11 to 15 lakhs new cases being reported every year in India, and 40% cases due to the lung mouth cancer every year. Around 1,25,000 women affected by the cervical and uterine cancer. Cervical cancer is the most common cancer found in rural India, and breast cancer is the second most common. And breast cancer is the most common in urban area in India. So that is the incidence, or there is a ratio for that. And everywhere in India, the 50,000 women die due to the cervical cancer each year. And 60% patients come to the treatment when they goes in advanced stages, that is 3 and 4, where the chance of cure is very less. So this is situation, this is a drastic situation for the cancer. The types of cancer: lung, breast, colon, endometrial, pancreatic, endometrial, prostate, thyroid, leukemia, out of which we'll focus on the cervical cancer. So there is a junction of two different epithelium at the mouth of the cervix or the mouth of the uterus, that is called cervix. There is scamocolumnar junction. Here the cancer gets started here and spreads laterally. This is the characteristic of cancer that spread laterally. That's why when it invades the parametrium, when it invades the lymphatic, when it invades the lateral pelvic wall, it becomes very difficult to cure. So merely the removal of uterus or doing the radical hysterectomy, the removing the uterus, lymph nodes, the related appendages may not be sufficient. That's why this is agony of cancer is spread laterally. That is a dangerous thing for the cervical cancer. Yeah. It's a very simple test, doctor. In India, even the gynecologist doctor, or any ladies doctor also, very less doctor used to perform this test. Very less to go for the test. This test has to be performed after marriage every year for consecutively for 3 years, and after that, every 3 years we can perform the test. That is called the pap smear test. In this test, Dr. Amrita, the cells are scraped from the cervix and examined under the microscope by the pathologist for the disease or problem. We examine the nucleus size, the shape of the cell, any abnormality, any clumping, that is examined by this test. This is called a pap smear test, and this test we perform routinely in the community camp. Near about 420 camps we conducted in 428 villages in the Indian rural population, and around 3 lakh patients we tested for this cancer, and we got a detection ratio of 2.1 to 2.2% in rural women. That is a very drastic incidence for this cancer. Second thing, we can scrap the cells and put it in the this is called the liquid-based cytology. There is another way, but there's no difference in the two tests. The test remains the same. Just we are testing the cells from the cervical area or the mouth of the cervix. We can get for the in layman's language. Yeah, this test has to be performed after marriage each and every moment yearly. That is very important. Knowingly, unknowingly, anyone can get cancer. That is the scenario for this. That's why this test is very much important. And this is the only one cancer in the world that is vaccine preventable. So any girl from 9 to 26 years of age should undergo a vaccination, a compulsory vaccination for the cancer, 3 doses, 0 to 6 month doses, either Gardasil vaccine or the Cervarix vaccine. Very much important because it is preventable. We got an additional advantage that this is the internal organ, first thing for the community. Second thing, the vaccine preventable. Then why don't we go for the vaccine? That is the crux behind this situation. Then these are the naming of cancer. These are the common chemicals, radiations, and bacteria. These are the routine, the cause for the cancer in Indian population, including cervical cancer, the tobacco abuse. Very routinely, the people are addicted, rural tribal populations are addicted for the tobacco, gutka, mawa, and very allied product like cigarette smoking, bidi smoking, very much. The cigarette smoking has smoke has a 45 types of cancer, carcinogenic elements, and very dangerous. If you smoke the cigarette, that is 20 packet for 20 years, you are 100% going to reduce the lifespan by the 20 years. And some may have the abnormal sequelae and may go for the serious consequences like cancer. Second thing, alcohol abuse. Alcohol is very good for the health if it is taken in the restricted amount, very small amount, like 20 to 30 ml per day, maximum 12% alcohol as the recommendation by the World Health Organization. That is good, very good thing. But unrestricted pathology, the unrestricted behavior, the main use of the alcohol abuse is people don't have restriction for alcohol. When they start the alcohol abuse, the very infrequently, any birthday party, anything else, any occasion, any festival, they should take alcohol. Then it becomes very routine. The people is drinking daily, then twice a day, then morning, evening, and they become alcohol abuse. And that is not a good point for the cancer pathology. Dietary factor, the complex carbohydrate diet, the fatty diet, or the pure carbohydrate diet is responsible. Weight gain is responsible for the cancer rise. Second thing, the occupational exposures in the chemical industries, when there is unprotected job or unprotected the job posting or the whatever the activity, there should be a sufficient safeguard for the occupations that are deals with the chemical industries or the asbestos, anything else. Viruses, the hepatitis B virus infection, the liver, maybe the cause for the liver cancer. And parasite infection also documented in Indian customs, habits, and lifestyles. In rural area, I have seen Neil sir and Dr. Amrita, very early marriages are going to happen in the tribal population. Like 14-year girl, 15-year girl, 16-year girl, 17-year, they're not physically competent for the marriage. Physically and psychological, they get married. And that's why the early sexual intercourse started. And that is the cause that is the most probable etiology for the cancer. Second thing, as everyone knows, that the transmission of the human papilloma virus from the male to female in couples, male to female, there is a transmission during intercourse, the human papilloma, there is HPV virus, and that affects the scamocolumnar junction, and that lead to injury to that part, sensitive part of the cervix, and that the next sequelae is the cervical cancer. That's why the protected sexual intercourse is very much important. Early marriages in women. Second thing, multiple pregnancies in short span of time. Very common in Indian population. That is also one of the predisposing factor for the cancer. And this has to be prevented. Second thing, the inhygiene of the private parts. Regular shaving, inhygiene. Some people use the chemicals to remove as a hair remover from that private area. That should not be used. We should use the razor or blade, whatever the blade or razor for the hair removal from the private. Unnecessarily, the NA was a very common chemical, very famous chemical available for the hair as a hair removal, peeling, but that should not be used. The razor or the blade that should be used to remove the hairs from the private part, and regular hygiene should be there to the private part. That is a most common. There's also a good factor I have seen in the rural population. Then the lack of sunlight exposure, the great pollution, indiscriminate use of the drugs, or the counter use of drug, very common in Indian population. That may be the reason for other tasks. Genetic one, the retinoblastoma in children and the leukemia in Mongols. These are associated with the genetic factors. See, cigarette smoking is a suicide, merely a suicide, I can say, in my opinion and my view. Because due to the peer pressure, due to the small kid parties, birthday parties, whatever, the school children get a habit of the cigarette smoking, video smoking, whatever, and they land up in the fulminant complications later on the line. They're habituated for this and they get addicted for the cigarette, and they may not be knowing the consequences at this stage. That's why there's the duty of the elderly people to monitor the child, to see the child, what the child is doing, what he or she is going, what they're doing. Any untoward complication also has to be looked for. This is the duty of the elders. Yeah. Then this is the risk for smoking. Every cancer, including cervical cancer, there is a risk. Each and every part of the body is affected by the smoking. So my sincere opinion to the community that we should avoid the smoking in any form. Any form, we should avoid the smoking. That is my sincere request after doing so much research and so much work in the cancer sector. Yeah, this should be strictly avoided. Like smoking affects the lung cancer, leukemia, stomach, kidney cancer, and the pancreas, colon, bladder, cervix, higher chance of stroke, higher chance of blindness, gum infection, the chance of major vessel rupture like aorta, heart diseases, pneumonia, hardening of the arteries, then the chronic lung diseases, reduced fertility, hip fracture. These are the things that are very commonly affected by the long-term smoking. Also, I have seen the recurrent abortions in the pregnant woman, the early abortion, premature deliveries, the highest, the operative rates for the cesarean section in the pregnant woman. That's why smoking should be avoided. It's not a smoking, it's a suicide. It's damaging our own body parts. So please restrain yourself for smoking. That is my appeal to the community. So these are the factors believed to be contribute to the global cause of cancer. So 30% smoking and alcohol, 18 to 20% chronic infection like HIV, human T papillomavirus, lymphoma, hepatitis B virus. Hepatitis B virus immunization is strict and compulsory in Indian population, and that is a very good thing. So hepatitis B vaccination should be done to children, and that is routinely included in the immunization schedule published by the government of India. Then the 30 to 35% causes are the unbalanced diet. So Mr. Neil and Dr. Amrita have seen recently the great trend of the screen addictions are much more. Second thing, the more carbohydrate, junk food, the outside foods, the hoteling people likes. And that's why they're consuming more oily food, more carbohydrate, high glycemic carbohydrates they are consuming. So they're taking more calories, and that is leading to the obesity, that is leading to the lack of physical activity, and that is leading to the predisposition for the more cancer. Every cancer, I can say. So that should be avoided. We should have the green leafy vegetables, low calorie diet, a protein diet, whatever your nutritionist or the diet expert suggests, that should be there. So obesity is we have got a rising trend, the weight gain, rising trend. That's why contributing to the many factors, like not only cancer, hypertension, diabetes, heart diseases, the depression, psychological issues, the stroke. So lots of issues are related to the lack of physical exercise, sitting job. That is called that we should not sit at chair for more than 8 hours, more than 6 hours. By sedentary lifestyle, by sitting on the office work, by sitting at the chair in comfort, doing the comfort of work, whatever work you're doing, we should not sit at prompt leg. because it has seen that scientists say that there is a coagulation system get activated, the coagulation of blood, the venous system get coagulated at the dependent part of the body, and lots of things, the chance of the obesity, we are not expending the not making expenditure to the calories, and that will rise to the obesity and again prediction for the variants. 8 to 20% causes lies in the hormonal imbalance. 2% accumulation, 1% pollution. That is the most important part in the metro cities, that we are getting such a great pollution, and more carbon particles in the atmosphere, we are getting the more incidence of the deadly disease like cancer. So what are the early signs for the cancer? Early cancer doesn't have any symptom. First thing, that's why our team has adapted 9 community projects, and the effort is to save the Indians, to catch the people in the early stages and cure the cancer, and completely we eliminate the disease. We can eradicate the disease by this simple measure. So prevention is always better than cure. So that's why we are catching the early cancer very initial stages. When there is intestinal cancer, change in the bowel habits, and in cervical cancer, the main thing is Mr. Neil and Dr. Amrita, the white discharge per vagina. Second thing, unusual bleeding or discharge. The bleeding after characteristic thing is the bleeding after the sexual intercourse. Fourth thing is pelvic pain, the pain in the lower abdomen. Sometimes we get a very foul-smelling discharge from the vagina. The sixth thing is the lower back pain, and these are the things: the change in the menstrual pattern, the pain, great pain during the menses, the pain before the menses, after the menses. Please look for the cervical cancer. That is my request to all gentlemen, and please go for the pap smear testing once. That is the most simple criteria to diagnose and correct. Okay. Skin cancer and lung cancer, that is the persistent curve for the worsening is more than 21 days may be the cause for the lung cancer. The recent change in the warts or mole color of the skin, that is responsible for the skin cancer. The screening. What is screening? In scientific term, if you catch the cancer in early stages, there are some tests available, common tests available to catch this disease. Not each and every one, but some tests are available to diagnose the common cancer, like pap smear testing for cervical cancer, cell-based examination for the breast cancer, oral examination by the expert for the oral cancer. So these are the tests available for the next one. So these are the tests available. So that is called screening. We advise the self-examination for the breast cancer, the pap smear testing. Those suspicious pap smear, we go for the biopsy, and X-ray, CT scans, MRI. These are the more related to stage the cancer, PET scans, ultrasound scan. Okay. Treatment option available for the cervical cancer, the stage 1 and 2, or still stage 2A. We can immediately go for the surgery. That is the radical hysterectomy we perform very nicely. And after that, the whole uterus, lymph nodes, ovaries, we send it for the pathological examination. And on the basis of the lymph node invasion, on the basis of the lymph node involvement, on the basis of the margin of the specimen, on the basis of the physical ability of the patient, so we go for the chemoradiation. We plan for the chemotherapy and radiation. So chemotherapy, generally we plan the 6 chemo cycles as per the report, and radiation, 32 radiations. So we go for the patient, so that patient should not have the recurrence. Patient have a good lifestyle. Patient should be disease-free. Patient should be cancer-free. That is the purpose behind that. Most of the patient do the surgery and they are free. That is not a point. Surgery may only helpful for stage 1 up to 2A, but later on treatment is very much important. That is radiation and chemotherapy has to be completed. That is my request, that the whole treatment should be taken. I have seen that lots of rural patients, they've seen that the surgery is done, they're feeling better, they're good, and then later on they leave the treatment and they don't listen to doctor. That is not a point. The treatment has to be complete. If you are disease-free, if you want to disease-free, everything the oncologists whatever say that we have to agree and we have to consider, and in holistic approach we have to complete the everything including follow-up. After the chemotherapy and additional cyclotherapy, that every 6 months we have to take a follow-up with the doctor for any recurrence we have to see. That is very much important. So what are the preventive measures for cancer? In that, the physical activity. Early morning, wake up and please go for the jogging, exercise, gym, whatever, swimming, whatever do you want to do. The physical activity should be there. In young age, the sweating should happen. Whatever you do, sweating should happen. You can go for the slow yoga, fast yoga, meditation, whatever do, but we should sweat. That is the basic priority. That will keep away yourself 90% fit and 90% chances that you will not get anything, any disorder in future life. So sweating, the physical exercise, merely the walking may not be sufficient in young ages. The walking is the exercise of the old age, basically 50, 55, 60, above 55, 60. That is a good exercise, but young ages, we should sweat. That is very important. Avoiding obesity, please avoid the high carbohydrate diet. Then the complex carbohydrate, junk foods, outside eating, hoteling, too much hoteling, that is not a good. Oily food, the junk food item, everything should be balanced. That your nutritionist should, we should take opinion for the nutritionist, for the BMI, for the what are the body mass index, very much important, not merely the weight. Body mass index is a calculation done by the weight divided by height in meter square. And the BMI more than 24, 25 are considered as obese. There is a criteria that mild obesity, moderate obesity, but your BMI should be within 24, 23. That is a good practice. And please adopt the healthy dietary practices. That is very important. Healthy dietary practices. Okay, that is should be done. We should more do the more focus on the natural food, green leafy vegetables, non-vegetarian diet, but that should be away from the animal fat, and also reduce your the occupational and environmental exposure for the chemical toxin. And we should have restricted alcohol use. That is great, but should not be unrestricted one. Unrestricted alcohol use, that is the drawback of the alcohol abuse, and that may become a nightmare for the patient. And at childhood, immunization against hepatitis B virus, that is much important. And safer sexual practices, please use the neuro or the barrier contraceptive to condoms for the sexual intercourse, so that the transmission of the human papillomavirus, transmission infection, lots of mixed infection like chlamydia, like lots of things will not be transferred from one partner to another partner, and that is always good. Okay, then the vaccination for the girls from 9 to 29 years of age, very much ideal. 3 doses of cervical vaccine, we prefer the Cervarix. There are 2 options available, either go for the cervix vaccine, Cervarix, or the Gardasil vaccine. We go for the Cervarix, most commonly routine the camps in the hospital. 3 doses are sufficient, the 0, 2 months, and 6 months, that's all. Keep your child from cancer, cervical cancer, away in future life. That is very particular part. Even if we are delayed till 60, 65, we can have a cervical cancer vaccine. We can do immediately to prevent it, because it has a little advantage, 20, 30% advantage if you go get that vaccine later age, 30, 40, but that is good for the health. So 90, 26, 29 is the ideal one, but if you get later on, that is also okay. But every woman should be vaccinated for the cervical cancer. That is my request. Okay, and please avoid the Indian population, avoid the early marriages. So avoid the multiple pregnancies in short span of time. Avoid the please have a good sanitation, the hygiene of the private part, that is very important, and the nutritious diet and the physical activity that is should be there for to avoid the cervical cancer. So that's all. I conclude myself. So any questions, Mr. Neil, Dr. Amrita?
Thank you. This was really very good presentation, and I would say this presentation is showing the real picture of what is required and what is the status. I have a couple of questions for you.
Please.
Before I take that, there is a question from, I think, Malti about curcuma turmeric, Meeta. So Meeta ji is asking about the role of turmeric for prevention of cancer at early stages. What is your take on that?
So, ma'am, I practice the allopathy, the modern medicine, the universally recognized medicine. So, whatever do, we should have the evidence. That is the first thing. Turmeric has a lot of great advantages. I understand, and it has an antioxidant property. It has a anti-infectious property. That is good. In our great science, Indian medicine, turmeric has a great importance, but I don't see any valuable support in the cancer care. Yeah.
I wanted to ask you, what is in your opinion, because nowadays, as you stressed a lot upon with your through your NGO upon public awareness and public education related with the basic things that people should know about preventing cancer, but the prevalence of smoking and alcoholism in female population has widely increased in a couple of years, as we see in India. And what is your studies as per your counts on the population, that how much that has affected for the prevalence of cancer in women folk related to cervical cancer for these people?
Very few cases, doctor, because cervical cancer is very much rampant in the rural population, and alcohol abuse and the cigarette smoking very rarely seen in the rural area. That is the issue of the semi-urban and urban area, but that has increased. I have seen that 10% rise in the population addiction in the urban and semi-urban area, but rural area has a different addictions like mishery and the different tobacco. These are the patterns available in the rural area. So not significant in the rural area, ma'am.
So we have Mr. Neil Kumar with us to have some comments. Yes, Neilji, please.
Thank you, Dr. Amrita. What a lovely presentation, Dr. Swapnil Mane. Let's share with the people that it's not only that you are an expert oncologist, and apart from your chosen subjects, your organization does a lot of outreaches that are so beautiful. So let's share with people about Saidam Hospital. We can show them over here that not only do you do oncology, you also do free cancer awareness camp in rural India. Why rural? Because those people are very underprivileged and they need that thing. And when you were young, you decided that you will reach the people who haven't got a chance to survive or the money. So I love it. And this is your website, Saidam Hospital. You can reach there. And also there is training for gynecologists. So it is not just oncology. You go through a training of gynecology where not only yourself, but some of your colleagues who have actually now joined you, together you bring out a very good structural method and also medical skill development, which is very useful because that is generally akin to anything to do with medicine. So this is a lovely website. You were involved in the COVID time during the free COVID. What a wonderful contribution. So the viewers can connect to you.
Thank you so much.
Learn about your initiatives and contact you as well. So Dr. Swapnil Mane, tell me, what is your latest project and are you planning to branch out in most of the states of India?
Yeah, it's a great the great pride to serve the Indians. We got a 30-bed hospital, so may not be sufficient to cope up the whole Indian population. And we got a 9 community project. So our research team has patented 4 operative techniques. So each and every part of the country, so most of the oncosurgeons, gynecologists from abroad and from India, they want to learn this technique. They want to learn this pattern of cancer care, that is Saidam model of cancer care. And we trained near about 250 Indian candidates, Indian doctors, and near about 25 foreign delegates for this model. And they are replicating this model each and every part of country. Daily at our cancer hospital, I'm sitting here, 30-bed cancer of charitable hospital. We got a 5 cancer surgeries, 150 outpatient department, 10 to 15 admissions per day. But we are not coping up the situation. that we are taking. So that's why our trustees, the team has decided to set up a big hospital, 500 bed cancer hospital at Shirdi. That is we got a lot of faith and belief in the Sai, the principles of Sai, Lord Sai, because the spiritual leader Sai Baba has done work from his 1958 to 1918 till his Mahasamadhi. That is a spiritual principle. But every team member like to simulate the work whatever Baba has done in their lifetime at Shirdi. So our trust has acquired 21 acres of land, and we are in the starting phase of the construction. Within 2 months, every formality has completed to launch the construction of 500 bed cancer hospital. Near of the 50 crore Indian rupees is the budget, and everything is so we need the shower, and please shower your blessings for this mega project so that every Indian should get treatment and no one is deprived without the treatment. That is our cause. Main concern is those patients are dying lack of the treatment at the rural area. They are also Indians. Those taking the treatment at the urban metro cities in the AC deluxe rooms, they are also Indians. Those people are standing in the long waiting queues in the government hospital like AIMS, Tata Cancer Hospital, KM Hospital. That is my main concern. So they are also Indians. So why such a discrepancy? Everyone should get a right of the basic health care. That is the main motto of our small organization, sir. And for that mega project, we need your shower support and blessings. So within 2 years, we are able to catch. We can provide the treatment to the all people whoever comes to the Shirdi. I invite everyone to come to the hospital, come to the new project that's near the Shirdi International Airport in Maharashtra, 270 kilometers from the Bombay, and a very ambitious project laid down by the Sai, because I have seen that there is a great anubhuti or the miracle, I can say. Our trustees was searching for the land. We needed near about 21 acres of land for the big cancer hospital. So we are searching for the land in different part of country. But ultimately, the 18 acres, 19 acres, 17 acres, we are getting the land, not 21 acres. So we got a phone from the Shirdi airport, Shirdi, just the farmers beside the Shirdi airport, that sir, we'd like to sell the land for this is rupees for the good cause. So that is not lesser than the miracle of the Sai, we think. And Sai Baba used to sit in that land during their presence before 1918. So we all team considers as a blessings from the Sai only. So we all are prepared for the venture, and that's all. That's the group.
Dr. Mane, not only are we going to bless you for the work you do, when you send me a short write-up and a URL where people can visit, we have got vast amount of social media groups where we are going to share your work, because it's certainly worth sharing to the people, particularly within the vicinity of where you've got the projects going on. It will be very useful. Now, before I let Dr. Amrita have a final chit-chat with you, can you give our viewers 5 simple tips, either to avoid cancer, and or what are best practices to make sure that you don't get cancer? I mean, obviously, it's maybe even a stroke of luck and habits, but one of the things you mentioned was cigarette smoking.
Yeah.
What are the 5 that you can tell people for their general well-being and wellness?
Sure, Mr. So we should conclude ourselves with a take-home message, but as suggested by Mr. Neil, sir, and the 5 take-home message. First thing, please remain physically active. So as sort of engage yourself in the physical activity, something, exercise, jogging, whatever. The physical activity is very much important, and avoid the sedentary lifestyle. Second thing, for the women, please vaccinate yourself as early as possible. Yourself and the children should be vaccinated as early as possible, because this is vaccine preventable. Cervical cancer is vaccine preventable, 100% preventable. So why should not we go for that prevention? Third thing, please remain away from any sort of addictions, whatever, from tobacco, cigar, anything, alcohol abuse, nothing is needed in the life. Only the nutritious diet is needed to remain the physically active, the spiritually active. Third thing is remain away from the addictions. Fourth thing, for the breast cancer, please do the self breast examination at the time of birth every day. by right hand, we can examine the left breast. By the left hand, you can examine your right breast and palpate over the chest cage. And we can, any suspicious lesion, any tumor, any mass, please consult doctor immediately. That is the most common cancer in the metro cities, urban area in women. So that is a self-breast examination. That is more important. And fifth thing for the rural Indian population, please marry at the right age for the childbearing, and please have a sanitation or keep a hygiene of the private parts. That's all, Mr. Neil.
Thank you, Dr. Swapnil. Wonderful tips. Dr. Amrita will also prompt you for a question. Just before we move over to our next guest, and we're going to leave India and go to United Kingdom.
Sure.
Before I introduce, or before Dr. Amrita introduces the next guest, which is here on the screen, Dr. Kirit Mistry, who is a resident contributor at Healing Our Earth. He's also at the South Asian Health Action Group in UK, which actually marries the community with the National Health Services for various kind of medical ailments. I would like to introduce you to him, Dr. Swapnil, because I'm now also going to introduce him offline on a WhatsApp to you. So you will be able to share, exchange ideas on your project of cancer. He comes to India as well, and maybe he can adopt or have a chat with the local authority over here and see what we can exchange with each other. So first, let's say hello to him. And here we go to Leicester, United Kingdom, to Kirit Misty. Global Namaste, Kirit, and how are you?
Global Namaste, everyone. Nice to see you all, and great presentation so far. So really amazing to hear the excellent work and the Healing Our Earth family, the people that we have within this family, the expertise, the passion, and most importantly, to serve our community and our fellow human beings is what we're here for. And you know, you're giving up all your time to do this. So congratulations, and really great work, Neil Bhai and Dr. Amrita, in terms of the whole way you put these programs together. It's amazing. So I'm really glad to be part of this family.
Thank you, Kirit. Kirit, I want to directly introduce you here to Dr. Swapnil Mane. He's in Mumbai. He has come very highly recommended through one of the sources. And actually, the original source was our own homeopathy expert, Dr. Mukesh Batra, whose friend Archana is the one who recommended Swapnil to us. Kirit, can you, when I give you the contacts over the WhatsApp to both of you, exchange ideas and see how we can help each other, how we can promote each other's work? And of course, when you go to India, when you land into Mumbai, make sure you give Swapnil a buzz and go and see him and see how we can encourage each other to engage into more sort of a work over here. Just before we go ahead with you, Kirit, and Amrita will introduce you. Amrita, your conclusion word for Dr. Swapnil Mane in Mumbai.
Yeah, Neilji, just a second before we conclude, I think Lataji raised her hand and she has some questions. Lataji, do you have any questions for Dr. Swapnil?
Namaste, everyone.
Namaste, namaste.
Thank you for a very informative presentation, Dr. Swapnil. And thank you, Dr. Amrita. You're doing a wonderful job. It's a new thing, isn't it, for you that you've taken on? Yeah, well done. Yeah.
Thank you.
So what I was saying to concerned about is the drinks, you know, like juices in the cartons and Coca-Cola and gassy drinks. You didn't mention anything in that direction, and I think because of thirst and all that, especially in India, it's an important thing to raise awareness. What do you think? Is it unhealthy to have gassy stuff or to avoid it? What do you feel? Because I think it's got a lot of cancer promoting.
The carbonated drinks and the Coca-Colas, which people rely on most of the time. That's what your question. So is it healthy?
Yeah, because everywhere you go,
Very true. So it's a carbonated drink and lots of chemicals, voluntary, involuntary involved, and that should be restricted. Okay. there is a say that in summer season we drink more cold drinks basically. So cold water, cold drinks, but that is not a situation. As a pathophysiological body is considered, we should have the normal temperature water, normal temperature thing.
Yeah.
But yeah, due to the cold drinks, we
And
have seen
boiled water. Yeah.
normal water during the summer season. That should be there, and the cold drinks should be restricted use. Too much intake, daily intake, the cold drinks are the full of chemicals and may lead to the acid peptic disorder, the stomach discomfort, and some chemicals are the carcinogenic chemicals that may lead to the Deadpool disease. Yeah, but that should be a restricted use. That is the most important for cold
Yeah.
drinks.
Yeah, and sugar. Would you say sugar as well is another
Sugar is a
important thing
restricted
to
quantity, just 3 to 5 teaspoons per day, TSF per day. That is a good sugar. It should not be in excessive quantity. Again, it comes under the pure carbohydrate diet. So sugar food is a good, but in restricted quantity. That is my opinion.
Yeah, because I think that to raise awareness on those two issues as well would be advantageous to promote prevention, you know, among educated and uneducated people, and reminders to the, you know, because it's convenience, isn't it? And it's so desirable sometimes when you're thirsty, and wherever you go in an event or a party, and as children, they're raised up on it. So, you know, that's where my concern is, to raise awareness in that for parents as well.
When you are thirsty, we should go for the normal water. That is the main concern. Not go for the cold drink. That is my suggestion. Because the cold atmosphere, like ice creams, cold drinks, whatever, when you take it immediately, they will decrease the immune response at the throat level, pharynx level, tonsil level, and the oropharyngeal defense ring is there. That's why when you are thirsty, go for the normal water first. And if you want to do, cold drink is not to satisfy the thirst. That is not made for the satisfy thirst. That is the additional high calorie diet. So water intake should be fruitful. Normal water always better. We don't want to drink the warm water. We don't want to drink the too cold water. That is the situation for this one.
Thank you. Thank you so much, Dr. Swapnil. You are doing a wonderful job. And as a physician, as a woman, I think I would like to personally also join hands with you because I belong to North India, and it will be really good. I would appreciate if you contact with the All India Radio and Vivid Bharati and other programs, because that is what people hear and listen to in India. And I think a lot of women would be empowered to hear that and will raise the voice. And I would also like to give an input, like training the young flora, like the young people over there, the young women folk in the villages would be very helpful for you, to give you an impulse of the data that you will be requiring, and also to bring patients early for the diagnosis so that their lives can be saved. So all the very best from our team, from all of viewers of the Healing Our Earth, as well as myself personally, and from Neilji as well. Great wonders. Thank you very much.
Thank you so much, Mr. Neil.
We request you, if you have time, you can please stay on in the program, because your inputs are also much appreciated.
Sure.
Thank you so much.
Thank you so much, Dr. Amrita and Dr. Mr. Neil from the Healing Our Earth team. It's a very great job the team is doing for the humanity and the livelihood. And also, but the first time I'm attending this session, that's why. So great congratulations and a lot of blessings to team and Mr. Lin, the very great job they're doing.
Thank you, sir. We will be requiring more inputs. We'll be bringing you very more frequently on the screen, so that many people can hear and know about your experiences and can make you best use of the social service you have been doing to your age. Thank you so much.
Thank you.
Global Namaste, Kirit Mistry ji.
Namaste, Global Namaste.
Good evening to you from UK, as we have moved to UK now, and we have our next speaker and an expert, Kirit Mistry ji, who is a lead for the health inequalities, and he is also the lead for SAHA, which is South Asian Health Action for NHS Core 20 Plus 5 Cancer Community Connector projects. So today we'll be having him to know more about the patient as well as the community engagement programs that he'd been running, as well as what all things he can guide to people in relation to the community health, as well as the programs that he'd been running for. Yes, stage is all yours, sir. Thank you.
Thank you. I'm going to share my screen. I've got a quick presentation as well.
Sure.
So thank you for the kind introduction. I was just wanting to kind of go back down memory lane. And when I was working in 1990, I was doing a lot of work around drug addiction and alcohol addiction. And I got an opportunity to go to Rajkot for our twinning. They're our twinning city in Leicester. And we were having a challenge at the time with a number of people coming from India to Leicester and chewing a lot of tobacco. And we were seeing a lot of Gutka products. As health workers, we were kind of concerned about the age groups that these products were available. So we decided that we needed to do some research, go back to India, and we were fortunate that we were supported to go and do some, go to the Oral Cancer Conference, but also go to Rajkot, go to the cancer hospital, and start to make the links around what are these products, what do we need to do? And we brought back a lot of samples of these products and got them to be tested within our environmental health, what the kind of concerns are. And you know, this was an exciting partnership we did with our Rajkot municipality, which with our local city council as well. And it's frightening to see, going back to Rajkot in January this year again, and making the links with the municipality and the mayor, that you know, the people in Rajkot is the capital hub for cancer, mouth cancer and oral cancer, particularly due to gutka and tobacco chewing. So, you know, we really need to be doing, you know, it's good to hear the great work that Sapulji is going to be doing in terms of giving free treatment to people suffering with cancer. And I hope mouth cancer is going to be a big part of support there. So I just wanted to give you a bit of a background to, I've been working in health for quite a few years, so I don't want to show my age, but so I presented this before, but in the UK, we have a national program by the NHS tackling health inequalities. And the reason why this program was initiated, because through the pandemic of COVID, we knew that some of the communities, South Asian communities and the minority Black communities, there was a lot of disparity around their health inequality needs. So this program it came about, and we as South Asian Health Action, along with a few other partners, are working to ensure that we get the community expertise, the community with lived experience coming forward. And joining me on this presentation is Shobna Ben, who's going to be talking about her experience. So I'm going to give most of the time to her. So this is a connectors program. It's about us as community organizations coming and working together with the community. We've got the links with the communities. The NHS system doesn't have the better links than we do. And also there's a lot of mistrust within the NHS by our community. So who better to advocate and make those connections and take those messages are our communities, our people from, you know, the people with lived experiences. So this is what this program is about. They've contacted three delivery partners. There's a women's organization, Shama, who's working on this program as and Equality Action and ourselves, really to kind of address the three clinical areas. Although there's 5 clinical areas in this program, the 3 clinical areas we are focusing on is early diagnosis of cancer and screening, hypertension, blood pressure, and respiratory. And it was great to hear Dr. Reshma Shah's lovely presentation around the early diagnosis and the importance of screening, you know, what we're doing in the UK. So going back to the connectors role, really, we as an organization, we're a small NGO. We are not big national charities, so we needed support, and luckily our local NHS structure decided to put funding to us to employ a coordinator who then will work with finding 10 connectors with different lived experiences of hypertension, cancer, and so that's kind of what the connectors roles are. And again, it's about going out into the community, raising awareness, and most importantly, getting the message out about screening, because we're fortunate in the UK, the NHS system is free and all of the screening is available. The challenge we have is people are ignoring their screening appointments, or sometimes they miss those appointments and then don't know what to do. And then that's something that we need to get them to be more educated. So Dr. Ben is a really valuable asset to our team, and she's one of our community connectors. We were working on this national program recently. It was a cancer bus that was going around the UK and it was coming to Leicester. So they asked us to get our connectors to be available on the bus to interact with the community, and particularly we have a high Gujarati speaking population. So luckily it was important to get to speak different South Asian languages there to be able to connect with the people in the community in the city centre around raising awareness of cancer and screening and diagnosis. This is the one work that the connectors do. They go to various community events. They get the communities really engaged to pass the message out, and hopefully at the same time raising awareness. They also pass the message of this project, but most importantly, Shobna will tell you more about the role that she's doing. So I just want to give you a flavour of, and Priti is one of our coordinators, and she goes around with not a flashy poster, but she's written she's written on a flip chart about getting people to interact with her, because it's word written and it says, do you want to know about cancer? And people will come to her. So give you these are social media handles, and people are welcome to contact us. I want to give the most of this time of this presentation to Shobna Ben, because she's the main person here today to share her experience. So thank you to Healing Our Earth for this wonderful opportunity to give a short presentation, but now give the opportunity to Shobna Ben, our community connector, to carry on.
Jai Shri Krishna.
Namaste. Namaste, Shobha.
Namaste.
Good to see you.
Thank you. I'm just intrigued, and just listening to everybody's input in there, and it's so much information and so much happening out there. It's an eye-opening for me today. Thank you, Kirit, for putting me on this global health awareness. And
you've been doing a wonderful job as well. As I can see, that's actually so.
It's just one of my journeys, which I think Kirit has encouraged me to talk. In the beginning, I wasn't actually very open about it. It was not a taboo for me, but it was just, I think, I didn't accept it that I had cancer. So now with Kirit by involving me in this Core 20 Plus, he's made me aware that we need to make people aware that they need to come forward for early diagnosis. If people are aware of it, that if they know that if they're detected early, and if the cancer is detected early and it's treatable, it's not one of those things where we can't treat it. So my journey, I had breast cancer, which started in 2016. And it was just a routine check, as Dr. Swapnil has mentioned in his talk, that I think women should actually do a breast check every day, and or once a week or twice a week if you can. But mine, it was just normal day. I was going to work, so I was having my shower, and while I was showering, I just I felt like a little lump in my right breast. And I thought it was just a little cyst on the outside first. And then when I looked, it wasn't, so it was inside. So at that point, I tried and checked it again. And it did feel like it was a little lump. It was like a pea size of lump. And then I went to work, and then it played a little bit on my mind. So I says, right, I need to, in my lunchtime, ring up the doctors and book an appointment to see the doctors and let them see, and let them find out and see if I need to go for further, checkup or anything. So I was lucky that I got an appointment in a couple of days' time when I needed that appointment. And the doctor examined me, and she said that at the moment, it's quite just a pea size. I'm not too worried, but still, I'm going to send you for a mammogram just to be on, have a peace of mind that it's not anything serious or any. So she sent me for a mammogram appointment. Luckily, the appointment as well came NHS, which is quite good. So the appointment came through within a week. And when I went for my mammogram, I think they had a little doubt. So they says, we're going to do a scan on you and a biopsy. We need to do a scan on you first. So I says, okay. So I was given another day. I had to come again for a scan. And when they did the scan, they says, we might have to do a biopsy. Are you okay to go for it? I says, yes, I should be fine. And they did a biopsy test. And that's when I think that the lady was like, radiographer was like a bit worried. And she says, okay, I will get in touch with you again. So when they sent off the sample for testing, and it came back and it showed that it had cancerous cells on it. So when I saw the consultant, and she mentioned that you have got cancerous, it is a cancerous lump, and we need to operate on you. So when the appointment that she gave me, it was the week when it was my birthday. And I says, no, I can't have operation during my birthday week. And she said, okay, we'll move it to the next, let me see the next available. So luckily, there was a following week appointment. So when I went for my appointment, when I had my operation, and because they had already measured a lump and when they operated, they checked the lump again. It had grown by 4 centimeters. So it was one of those aggressive cancer. But because I had acted early and I went to the doctors early and I had my operation early, even by delaying that 1 week, it wasn't, I think it would have, if I had delayed more, then it would have spread more. But luckily, I took the next following appointment. So this is one of my key messages to people. If you get your appointment, do not put it off, and let them do their duty and let them carry on. But luckily, I was lucky, very lucky. And when they told me that we would, because it is an aggressive one, we will have to do a chemotherapy and radiotherapy. So I think in the beginning, it didn't even sink in that I had cancer at that point. And just when they said the chemo word, that's when it hit me actually that I had cancer. But they assured me that because it has been detected early and, we can treat, it's treatable. So I went through all my treatments after that. After the operation, I had to wait 2 months, and then they started the treatment. And when I had my chemo sessions finished, I had to be operated again just to make sure that no cancer cells were left in there. And then they carried on further treatments with the radiotherapy, and I had Herceptin injections as well. And this is what I would say to anyone, that if you need to examine yourselves. It was just by routine. I must have just checked it at that point. I didn't actually check, but now I make people aware through being one of the connectors on Core 20+5 with Kirit. We make people aware of being detected early if you have cancer, but don't be, it's a taboo subject in our Asians here, actually, not to talk about it. They're either shy or they don't want to, I think it's fear as well in people. And it's just they won't share it at that point. Or they're scared about the treatments maybe. But treatments are harsh, but if it is caught early, it is treatable and you can manage yourself exactly. So I would say definitely, please, if you get your mammogram appointment, have yourself checked and routinely. If you feel it's not only a lump in your breast, it could be anything else as well. It could be nipple discharge. It could be just pain in the breast, or you generally not feeling well. You've got fatigue in yourself, even sometimes redness, swelling. You could have that in yourself. So let the doctor decide that and let them check it out and take it from there. So don't wait till it gets really worse and so I'll go tomorrow, I'll make an appointment, put yourself, oh, I've got this work to do, I've got that work to finish. You put yourself first and make sure you get yourself treated early as possible. And with the Core 25+, which we're doing with Kirit, we go around wherever there are functions or things happening, we have a little slot in there, and Kirit by Priti Ben and other connectors are there, making people aware that this is what we are doing. And there's facilities in our NHS which is quite very good. And if you go for your mammograms regularly, if you get yourself checked regularly, you'll be saved yourself as well. And my other that's, I think, the main thing I would like to say on myself, that make sure you attend your appointments.
That's lovely. I really have a very, what could I say, a big blessing corner for you, and a very big hug for you, because
I'll take it, Amrita. Thank you.
Please. Because this courage is tremendous. I think my mom is also a stage 3 rectal cancer survivor, and that's what she's putting up well. But then that first step is so important.
Yes,
to go to the physician and to accept everything. So what I wanted to ask you is that how did you manage up with the chemotherapies? Because surgery is one part, but chemotherapy and radiotherapy itself is so challenging in itself.
Very.
And it's so energy driving that itself needs a big motivation. So how did you put up with that, and how do you train people for that part of the treatment?
Dr. Amrita, that's a very, very important question you've just said. Actually, it is, I think because of that, a lot of people get put off, but that's the main thing you have to look at it, that if you have family, if you have friends, if you're on your own, if you've got friends who you trust, and talk to them if they can help you. I was very, very lucky. In the beginning, like I said, I didn't even tell my diagnosis to my work colleagues or my family. Only my husband and my elder daughter knew, because my other 2 children were in uni. One of them was doing her final years, and the other one was the first year. So until they had like a couple of weeks before they come back home. And that's when I was diagnosed as well. So the younger one, the middle one, was the one who was finishing her finals, and she was the one who helped me with my treatment. Actually, when she came back, she had booked herself with the appointments for her work, because she says, oh, I've already had my work interviews. So she was ready to get back into work and do things with her life as well. So when she didn't get her interviews passed through, so when I had my first chemo done at that point. And when I came back, because you're also new to chemo yourself, and you don't know what was going to happen to you. You read a lot, you hear about it, but you don't know when it actually happens to yourself. And that's when first day, it wasn't too bad. It was like gradually coming down into your body, and it's going in, and your temperature starts building up, and you start losing your taste buds, and you feel tired more. So, and then I was always very, very nauseated as well with the chemo. So it was constantly that. And then the whole week I was like really bedridden basically, and I couldn't eat or drink much as well. And that's when I think my daughter, when she saw me in the second week as well, that I was like that. So she says, I'm not going to apply for any more jobs. I'm going to look after my mom, because the other daughters and everybody had said, we'll all work around together. But because of your work commitments as well, it's not easy and simple to do that. And because the chemo was quite harsh, I could not stand and cook either. I couldn't take anything in. So I was very blessed, I should say, to have my daughter looking after me. And she nursed me through my chemo and my radiotherapy as well. And she's found a good job now, and she's working well. So, my blessings go out to her a lot, and my family as well, everybody. And I would say to everyone the main thing would be to remain positive. That was the main thing I needed to do. And I had so much of encouragement from my children as well. When I had my first chemo, after that, I said, right, I had like 3 weeks, which were really bad. And then the 1 week I had, which was fine. and I could get my taste buds back. And that's when you have to go for your blood test again and make sure that you can have your next chemo. And then I would say, right, I'm not going to go for another chemo now. And they would say, they would say, but mom, you have to go. This is you have to go in there. I says, no, I'm not going to go. So I says, all right, mom, we'll listen. They just left me. He says, all right, we'll look at it when it comes to it. If you don't want it, don't do it. That's what they did. Come to the point when I had to go for my blood test and my chemo attendance. Mom, you've done so well. You've done one already. You're going to go on to the next one. And then next month I would do the same thing again. They just encouraged me to say, Mom, you've come halfway now. Look, you're so better. You're getting better. You're getting there. But this is what I mean. You need that support from your family or your friends. If you are on your own, it is hard. It will be hard because if you don't eat properly or if you don't sleep properly, you are going to be struggling yourself. And you need that positiveness as well. So you don't want any negativity to say, people come up and say, oh, bichari, no, you're not bichari. It's just one of those things which you have to accept. And I mean, I did a lot of prayers and I get myself, I say to God, I leave my life in your hands. And you are the ones who are going to carry me. You've given me this, I'll do it for you, but you have to guide me and you have to support me as well. And that's what I did throughout.
That's very lovely. So basically you are saying optimism, family support, love and compassion from your near and dear ones plays a very important role for moving into all that. So Kiritji, what all basic tips do you guide to people as a community awareness through your programs in general to people, how they can cope up with these times? So every time we talk about prevention, we had been talking a lot about all these stuff, and we had Dr. Reshma also talking about this. So what are your tips and guidances for people in general community who are taking the treatments, and how to prevent other kind of illnesses, because there's so many side effects that come through chemos and other stuff and the disease itself. So what is your take on that? Thank you.
So thank you. Firstly, thanks to Shobna for giving her personal journey about her lived experience. And I think I've been a fond for some time I've been doing this work for many years. I'm a fond of having people with lived experiences telling their story and getting the message out, because they live it, breathe it, they've gone through it, and they're the better people. Listening to them can actually change and learn and how they can better manage and realize that they can't suffer in silence. So what we tend to do is, obviously we have our connectors, but we have got a number of wonderful organizations, support organizations. So sometimes people don't know about these organizations. So our role is to make sure that we connect them up with alternative support. They may alternative therapies, that may help them. We may find they may be struggling with certain money issues to get some support. So again, we will connect them with organizations that can help them for that purpose. But I think our role is, we're a patient care community-led NGO, and that's our focus. We work with the institutions, we work with our healthcare professionals to ensure that those healthcare professionals connect with us, and then we lead them to the communities to pass the professional message that they should be, and the medical message. We're all we advocate, don't advise, and that's our core focus. And since my journey of doing this health promotion, where our SAHA works on a number of areas, from diabetes, kidney disease, organ donation, blood donation, and most importantly now with this NHS cancer, hypertension, blood, and mental health. So if you've heard what Shobna Ben has said, when you're firstly diagnosed, that has a real impact on your mental well-being. And, that's where the support needs to come as well, and organizations that can help deal with that. And sometimes, with our faith is important. And obviously this family of Healing Earth, the kind of meditation and the alternative ways of dealing with, challenges in your life is something that we should be guiding people to. And again, we're fortunate in Leicester, we have Brahma Kumaris, a big, spiritual organization, and we have our local temple, gurdwaras, and mosques. So people at this time, when they've given the challenging news, I won't say bad, but given the challenging news of a diagnosis, they turn to their spiritual kind of context of looking for that advice and support. So we combine a holistic support to ensuring that they get the right medical support. But final message really is our kind of hashtag is going to be screening saves lives, because our work is about saving lives, and that's what we need to ensure people know about the screenings that they should be entitled to. And that's our constant mantra. When we go out into the community, we ask them their age and we say, okay, have you had your screening letters? If they hadn't, then we will then help them to make sure that they proactively seek that from their GP or their local hospital.
Thank you. There is a question from Meeta G, and she's asking, the UK Cancer Research website has listed below some of the things which are lacking in scientific evidence and special cancer diets. There are many types of diets. Some claim to cure cancer that are very beneficial, and there is no strong scientific evidence for some of them. Below diets are Gerson therapy, alkaline diet, ketogenic diet, macrobiotic diet, fasting, organic diet, and dairy. So what is your take on that?
So we're fortunate, we're working with our National Institute for Health Research, and again, we need to work with universities and people who are carrying out research to get, the Ayurvedic and the kind of alternative, ways of treating certain conditions more evidence-based. And that's our biggest challenge in the UK around evidence-based, options. And again, we can only further collaborate with people who've got the expertise through the Healing Our Earth family and the institutions to say there has to be, an approach around getting evidence of, Ayurveda, getting evidence on turmeric and all those kind of herbs that we are kind of used to, and do that properly in terms of having some clinical research around that. But again, it's going to take time. It's going to need a lot of lobbying. But luckily, I sit on these boards to try and influence, our South Asian perspectives. And finally, I think it's important that, again, we may have to do some of this evidence-based research ourselves through the institutions that are connected with this Healing Our Earth family, because sometimes we can't let others do it. We've got to do it. Health is in our hands, and we've got to take that message and then prove it to the institutions that this, Ayurvedic hundreds of years, old, and in terms of the methods of that, we've got to prove it. We should be proving it, but what we should be doing is people who are on this journey to treat them through self-care or self-healing, we should ask them to capture their personal journey, write about it, so that would then enable us to have the evidence that we need. I think Sharron wants to come in as well.
Yeah, can I just say one thing? Sorry. During my treatment, after my taste buds had gone, I was completely off sweet things. I didn't like anything sweet at all. So I could eat like anything tangier and tangy sort of thing, but nothing sweet. Like even like doctor says, you need to drink a lot of water, and you can drink like squashes and Cokes or whatever you fancy. But to be honest, I was lucky that I couldn't eat anything sweet, and that helped my healing a lot quickly as well. So one of the things, I think, to me, that helped a lot quickly to recover quickly as well. So I would say stick away from sweet things, because cancer, I believe, it feeds on sweets, doesn't sugar. So yeah, but Amrita, I wish your mom a speedy recovery as well, and pray for her.
I wish for you as well. She's been pretty doing well, and I wish I could have brought her at the platform well. But then her wishes to everybody, because what I wanted to I want to ask you one question again, Shobhana ji, that so are you still without sugars now? And what kind of checkups do you go for? Because this after checkups are so important. People think they have been cured, the chemo, radiotherapy are done, and they just lose everything. Now it's up for me going to the hospital. I won't be going up again. How important do you think is to getting yourself checked after all this has happened?
Right. I had my last checkup in 2020 when I came back from India on my holiday, and I had a couple of days later I had my appointment. So the consultant appointment was there, and after that I had during the pandemic I had quite a few every year I had my mammogram come through appointment. So I used to have my mammogram appointments. And if I feel that something is not right within me, I would straight away book an appointment. So you do get a yearly checkup after the treatment. And then it would turn to 3 yearly after that. But like in between, if you're not well, you can still go. And I still have not stopped myself from examining myself. So I would suggest to people, if you feel that you're not still well, or you still need to examine, you still do. Yes, you do still need to look after yourself. And I think with all the treatments you do, I've got now arthritis, so it is one thing leads to another, but I'm still here and I'm still well. That's what it is, because I have been examining myself completely, and I keep a lookout for it as well. And mostly exercising, they say, and walking, and good diet. That is it. But now I can eat my sweets, so I am a little bit naughty at times. Yes, but yes, I would suggest those who are on treatment, if you can avoid sweets, it would be better. Have it, but in little moderation, I would suggest.
Thank you very much.
Thank you very much, Dr. Amrita.
Thank you very much, Kirti. Lovely to have you both, and I look forward that you all come to the stage again, and let's make this platform a global platform to share health and wellness through empowering people like you. Thank you so much.
Thank you very much for having me. Thank you. Thank you,
around for more comments and chit chat. Please don't go away. We need your blessings as well as comments. Thank you. Let's move to US. Sharon, you are looking so pretty. Okay, we have our future events which are coming up. And before we move to Sharon, we'd like to remind our viewers that we are having our World Environment Day on Sunday, 4th of June, 2023, 2 p.m. BST onwards. And then we follow up with our next celebration of well-being and wellness episode, which is on 11th June, 2023, 2 p.m. BST onwards, which is followed by International Yoga Day. And that Yoga Day special, which is on 18th June, we are celebrating 2 p.m. BST onwards. And continued with our second episode of International Yoga Day celebration on 25th June, 2023, 2 p.m. BST onwards. So don't miss this opportunity to hear us live with our experts on different things and topics which are very vibrant, which are coming. Guru Purnima special, which is on 2nd July, 2023, 2 p.m. BST onwards, where we will be having the blessings of the gurus with the students. So that's what. And now we move to Sharon at USA, where I would say her good morning. And Sharon, I can see your outfit is pretty similar to mine, with that tie and dye stuff and the beautiful necklace. And you look so gorgeous in this red and yellow.
And global namaste to you all today.
Namaste, global namaste to you as well. So with this beautiful outfit, what new things? Because I had been hearing you in the last one, that was my first meeting, but then I worked with all my heart to you, because such a beautiful job and such a beautiful cooking and lifestyle and everything, and you have got tremendous potential for us to share. And before I chit chat with you, let me introduce to the viewers about you. Sharron Rose, MAED, a winner of the Filmmaker of the Year Award from the 20th World Congress on Qigong, Tai Chi, TCM, Daoism, and Natural Healing, and is the director and producer of the forthcoming documentary series Quantum Chi, the Taoist Art of Nurturing Life. Sharon has lectured, performed, and presented her films in numerous universities, spiritual centers, cultural organizations, and museums, and was a consultant to the National Endowment for the Arts. She is the author of The Path of Thesis, a guidebook for awakening the divine feminine, and is currently completing a CD, The Nectar of the Bliss, dedicated to the healing power of divine feminine in the cultures throughout the world. And here's the website where you can go through and look into her wealth of knowledge that she has shared through www.quantumchimovies.com and www.sacredmysteries.com. So here we have the lovely lady with us, loads of stuff to share with you. Over to you.
Yes. Well, the first interview I have was recorded. It's with Nathan Crane, and he has so much knowledge that I'm very excited to share this with you. So I'll just start by sharing.
Sure. That's me. Well, but what I would like to know apart from that is like your incredible input into feminine energy, as well as working up with the feminine stuff through divine inclination of healing power is really beautiful, right? And so how do you see the perspective of our today's topic, which is related with cancer and divine energies and the feminine feminine energy that a female or a woman holds?
Well, I've had my own experience with cancer.
Okay.
So I think I should talk about that.
Sure, sure.
When my mother had a miscarriage. Her first pregnancy was a miscarriage. So this was like 1949. She was given a drug called diethylstilbestrol. They said would prevent miscarriage. Well, it did. And, but in my, like, what was it, early 20s, I started having like cramping and all kinds. I always had very painful periods. And so I went to a doctor. They said, oh, you have a strange cervix. It's like all this extra stuff, and that must be causing it. So they cut it off, the strangeness, they said. But later, a number of years later, when I was living and dancing in New York City, I went to a female gynecologist, and she asked me, did your mother take DES? That's the name for it. And so I asked my mother, and she said yes. So then the doctor said, well, you're going to have to be very careful, because they found that in women, it causes a rare form of cervical cancer, very rare. And in men, it causes men to grow breasts. And that you'll never be able to have a child. Well, that wasn't true. So I had my child, I was fine, but I was always aware. I was getting pap smears, always aware. And I did a lot of alternative. Like if it was a little bit off, there were all these suppositories. And then I even did, in India, you'd probably understand this, douching with urine really helped. And it would always come back. And then I was making a film. I'd made all these documentaries, but this was a feature film, and the stress was outrageous. And I found, I started bleeding, and I went to, and they said, oh, the doctor was like, oh, and sent me to a gynecologist. And she said, oh, you have cervical cancer. I said, well, what's the prognosis? She goes, well, let's see, what was it? Radiation, chemo, surgery, and death. That's what she said to me. And I said, well, I'm not going for those. I'm going alternative. So I completely changed my diet. And I had an acupuncturist, actually, who put me on this drink, this green drink, I'll call it. It's got incredible components. And I'm still doing it now, my husband and I. And I did a lot of meditation, a lot. This is Tibetan. There's specific ones for healing, for cancer even. And they sent me to an alternative doctor. Oh, you can go to this woman who deals with people like you, right? So I went and had a PET scan, and she said, oh, it looks like there's nothing there. And you'll find this interesting. So I was sitting there and I had my mala, and all of a sudden my mala broke. I'm like, what's going on? So my husband said, well, maybe you should do an exam. And they did, and she found this little piece of cancer. And then they thought I should just have surgery, which I did. Probably if I'd had more support, I would have not had surgery and kept going. But the whole experience with the medical profession, except for the surgeon, was horrible. It was just horrible. And, I've been involved with alternative chiropractic, acupuncture, Ayurveda, etc., for many years, since I was like in my 20s. And this whole experience of being an experiment for the medical profession, from giving my mother this drug, has turned me, I'm very skeptical, and I try to do everything I can. I work with naturopaths, I work with acupuncturists, etc., everything I can to maintain my health in that way, because I don't trust them. I have that experience. So that was in, let's see, how many years? It's about 12 years ago. And I'm fine. I keep doing everything to.
Yeah, the stories, in fact, often every individual has its own lessons actually to give. And then your story definitely is pretty different to know how a single drug given to a mom can change and bring mutational changes in the children, which other doctors have been saying. So you are an example that has proved how the lifestyle has been saying. And in Ayurveda, we have been stressing a lot about Garbhini Paricharya, which is the regime that should be followed during pregnancy, which is one of the important keys to have a healthy progeny and what all things. So this basically is giving a clear indication on what all things. But the thing is that your story and your healing power and your faith in yourself and positivity and your internal spiritual love for life basically has given you a way off to move into all that stuff. And that's what is bringing to you. And that's what I can see, the aura of the energy that you hold has made you go away. All right.
Well, one more thing I want to say, because you mentioned the divine feminine. And during that period, first of all, I was living in this another amazing community, and I had everybody praying for me. And I had a friend, Robert Lawler, who was a very knowledgeable in metaphysics and religion and cultures, and he'd lived in Pondicherry. Taking out, because it was radical hysterectomy, they called it. They're taking this out, but now you will have the womb of the goddess. So, and so I've never really had any issues since then. And, my work continues. But I have to say that at least here in the US, the medical profession in general seem that all they want to do is test you and scare you. That's been my experience. My husband just had an experience like that. They just want to, they see if you have insurance, then, oh yeah, you need this, but never, the only thing they ask you about your emotion, they'll say.
I think Neil Kumarji is there with some comments or something. Let's have him. And then I'll leave the stage for you as well. Neil, do you have any comments?
Thank you, Dr. Amrita. What a wonderful job you have done. Sharron, Let's go and introduce Dr. Amrita because she was the start host, so there was nobody to introduce. And then if you could introduce Nathan Crane as well, before we play the lovely interview that you've got. So if we go and we introduce our Dr. Amrita, the starting host, please go ahead, and then we go to Nathan.
Dr. Amrita Sharma. Dr. Amrita Sharma did her bachelor's in Ayurvedic medicine, very smart thing to do, and surgery. Wow. BAMS and MD, Ayurvedic Materia Medica. Her interest in studies took her back to explore more on alternative medicine, acupuncture, alternative therapies, naturopathy, and courses on food and nutrition. She is registered with Yoga Alliance for E500 hours and YACEP. She has trained thousands of students from over 20 countries. She has more than 15 years of clinical and teaching experience in fields of yoga, Ayurveda, and holistic healing therapies. Dr. Sharma has presented paper and moderated numerous national and international conferences. Through her radio talks and podcasts, she has shared her experiences, well-being tips, and lifestyle leads in day-to-day life through yoga, Ayurveda, and holistic healthcare. How wonderful.
Thank you.
Thank you, Sharon. That was wonderful. Thank you, Dr. Amrita. You can have a bit of your evening snack or something. Be around to chat with Sharon, because Sharon has got a very exciting video lined up. Another way of talking about cancer and another guest. So thank you, Amrita. Sharon, let's go and introduce Nathan Crane so that
okay, it's in the video, so I'll just get the video. I introduce him in the video.
Perfect. So, go ahead, please. Beautiful. We have lift off.
Global namaste to you all. It's such a pleasure to be here with you on this cancer awareness program. And I'm Sharron Rose. You all know me. And today I have an incredible guest who's gone so deep into cancer, healing cancer, working with cancer. His name is Nathan Crane. Global namaste to you, Nathan.
Thank you, Sharon. Thank you for having me. Super happy to be here.
So Nathan Crane is a natural health researcher and holistic cancer coach. He's an award-winning author, inspirational speaker, Amazon #1 best-selling author, and 20 times award-winning documentary filmmaker. It's fantastic. Nathan is on the board of directors for the Beljanski Foundation, a nonprofit conducting scientific research into natural solutions for cancer. He's also the director of Healing Life, president of the Holistic Leadership Council, producer of the Conquering Cancer Summit, host of the Conquering Cancer documentary series, and director and producer of the award-winning documentary film, Cancer, the Integrative Perspective. Wow. Wow. What a wonderful guest to have today. So Nathan, how did you get involved in this cancer research? What led you to this?
Yeah, so the short version of that is my grandfather was diagnosed with cancer, and when I went to go visit him in Arizona, I believe it was around 2012, he had been already pursuing the conventional methodologies for cancer treatment. He had leukemia, so he was doing chemotherapy and radiation. And before he started treatment, you know, he had some symptoms and he had some clear health issues, but he was still fairly active. After the treatment, it just destroyed him, destroyed his body, his mind, his spirit. And when I saw him, he was in so much pain from the treatment, he could barely walk to the bathroom, 20 feet away. And I knew there had to be natural solutions for him that I could guide him towards, because I had been in natural health research for 7 or 8 years up to that point, cleaning up my own health, my own past addictions and health challenges, meditating with gurus and monks and Tibetan monks, and learning about spiritual practice and cleaning up my own life, my own mind, body, and spirit for about 7 or 8 years up to that point. But I realized I didn't know anything about cancer. And when I was sitting with him, it was like I knew there had to be solutions for him that could help him to ease the pain, ease the suffering, maybe improve his immune system, improve his ability to fight against the cancer instead of just trying to destroy it with chemicals and radiation and drugs that were actually killing his body as well as killing the cancer. But I didn't know anything about it. And so I sat there helpless and hopeless and didn't know what to say, honestly. And in 2013, he passed away. So that's about 10 years ago now. And that led me to obsess about cancer. What causes it? How do we create it in the bodies? Where does it come from? Why is it exploding all over the world at rates we've never seen before? Why are children born with it now when they never were born with it before? Why are populations just exploding with cancer everywhere? So I started interviewing the top cancer doctors and researchers, health experts, and cancer thrivers, people who have overcome cancer using natural solutions or holistic or even integrative solutions, and started interviewing them, started putting together a community, started putting together a mastermind group of different holistic doctors, produced conferences, documentaries, summits, reading the literature, reading the research, going deep into PubMed, learning everything I possibly could about it, because as I learned more, I realized that cancer is not only primarily preventable, but we have so many other solutions available to us that can empower us to heal from cancer if we don't want to choose the conventional approach. If you want to choose a conventional approach, that's your choice. It's totally fine. But I'm a person that believes in natural and holistic solutions first, and discovered that, wow, there are so many things we can do naturally, holistically, non-toxic, that don't kill our body, but in fact empower our body and mind and spirit to fight against cancer and to help remove the cancer cells from our body. That's when I just knew I had to keep doing this work to help as many people as possible. So as I learned from myself and my family, we, and heard incredible stories of people reversing stage 4 cancer, sent home to die. Prognosis is you have 3 months left to live. Get your will and testament in order and go die. And here they are 12 years later, cancer free. How did you do that? How did you do that? And so as I started meeting these people and interviewing them and researching it and noticing patterns and noticing similarities and noticing, oh, this is what they did with their diet. Here's what they did with their mind and emotions. Here's what they did with their spiritual practice. Oh, look, they all have these things in common, every single one of them. Okay, so now you put together these patterns and say, okay, actually there's a blueprint emerging here. And so that's kind of what I've identified over the last decade is what is that anti-cancer blueprint? Whether our goal is to just never have a cancer diagnosis, or hopefully if we do, it's not until the very, very end of our life, and it doesn't really matter anyway, because most cancers have very few symptoms. People don't realize that. Some cancers are very painful and they do have symptoms. Many cancers have no symptoms or very few symptoms and are not very painful at all. And then we go down the path of, trying to destroy it like an invading army, nuke it and attack it. And we destroy our bodies at the same time. And we go from somewhat healthy people to even worse unhealthy. So you can't be fully healthy and have a cancer diagnosis. They just don't go together. And we could talk about what I've discovered that actually causes cancer and what I've discovered the solutions we can help our bodies, prevent cancer and help fight against a cancer diagnosis. But as I meet more and more people who have reversed cancer, and now with the coaching program I've put together with documentaries, with series, with an online community, I'm super blessed to get emails and calls and case studies from people who've been following my work for years now and say, hey, I've been doing everything you've been teaching, the past year, past 2 years, and now my cancer's gone. Thank you so much. And it's like, it's like you save somebody's life. How can you not keep, doing that kind of important work? So for me, it's like, it's become a little bit of a life mission, and something that I feel is really important, that people get the education they need that they don't have access to from conventional medical, the conventional medical industrial complex, because that's not part of the training. Conventional medical doctors, certainly here in the West, I'm in the United States, they don't get trained on nutrition, on diet, on spirituality, on emotional healing. That's not their training. Now, if you're an Ayurvedic doctor, or you go and train in functional medicine or integrative medicine, you will start to learn those things. But majority of conventionally trained oncologists today get less than 6 hours of nutritional training in all their years of school. I mean, I've spent thousands of hours learning about nutrition and diet, and I'm not even a doctor. And our doctors today get 6 hours, and it's for things like vitamin C to help prevent scurvy. It's like things that it doesn't even really matter today. That's like the kind of nutritional things that people, obviously vitamin C matters, but scurvy is like, come on, we solved that with the Mayflower, right? Like you realize, hey, everybody needs vitamin C. Okay, done. So anyway, my mission is just to educate and empower people so they know the options that they have, so they can make an educated decision for their own health.
Well, here at Healing Our Earth, we're very much into alternative healing methods. And so we would love to hear about some of the insights that you have achieved through all this work that you've done, particularly in the areas of like diet, emotions, how to deal with the mental aspects of it. Because, I know from having had cervical cancer myself, that the minute you tell someone that you have cancer, unless they've had it or someone else in their family or close to them has had it, they act like you have some horrible contagious disease. I found that very difficult to deal with.
I bet. Yeah, I can imagine. I mean, and that's how I was. It was like, cancer, whoa, what is that? I don't know anything about it. All I know is, like when my grandfather was like, all I remember is this flashback of when I was a kid, and my best friend's aunt had cancer. She went through the conventional treatment, lost all her hair, got sick, and died. And so that's what I thought of cancer since a little kid, right? You lose all your hair, you turn pale white, you get skinny, you get sick, and you die. And it's like, we think that's cancer, but that's actually not cancer. That's the conventional treatment for cancer. So it's also about bringing truth into the mainstream public, in education or re-education about what cancer actually is and what causes cancer. Because the more we know about it, it's like, okay, the less we're afraid of it. And the more we can understand somebody who has a cancer diagnosis, who doesn't need to be sheltered and coddled. And it's like, no, we need, and to realize, like you said, people kind of like subconsciously, they know it's not a contagious disease. Consciously, people know it's not a contagious disease. Subconsciously, people act like it's a contagious disease. And part of that is the language programming that we have. She got cancer. He got cancer. You got cancer. You got it. You got it from where? From out there? Somewhere out there came in and you got cancer? Right? So we have to start thinking about it and speaking about it differently. You didn't get cancer, you made cancer. Your body makes cancer. Our bodies make cancer every single day of our lives. Dr. Thomas Lodi, good friend of mine, he's a doctor out of Thailand, has a successful clinic in Arizona. And one of the things he said to me that will always stick to me, he says, look, I teach my patients how to stop making cancer. Because it's not about going in and removing it, or you can remove it with surgery, remove a tumor with surgery, but if you don't stop making it, it's going to come back, and usually comes back with a vengeance. So how are we making cancer? Well, through my research, I've discovered there is 5 main causes of cancer. If people tuning in, if you want to write these down, it might be a good idea. But the first one is chronic inflammation. We'll touch a little bit into each one of these. The second one is an unhealthy diet. Third one is sedentarism. Sedentarism, being sedentary. The fourth one is toxic burden or toxic overload. And the fifth one is stress. And stress encompasses all of mental, emotional stress, trauma, childhood adverse events, even spiritual stress or spiritual disconnection, loneliness, not connected to a purpose in life. I group all of that under stress because all those things are stressful. If you're not connected to a higher purpose in life, you're not connected to a higher, spiritual outlook of your life, of the earth, of the universe. All of those things cause stress, cause loneliness, depression. So those are the four main causes. When I look at all the literature, all the research, as well as all the case studies, and interviewed literally over 400 doctors by this point, I really boiled it down to those five: chronic inflammation, unhealthy diet, sedentarism, toxic burden, and stress. The first one that will make the most sense for people is understanding chronic inflammation, because chronic inflammation is the underlying condition of every metabolic disease we have today: diabetes, autoimmune disease, heart disease, neurodegenerative disease, Parkinson's, gut issues, you name it. Every single one of these primarily preventable chronic diseases that we experience today that are exploding, by the way, exploding in every country around the world at rates we've never seen before. Every one of them has chronic inflammation in common. So chronic inflammation, what's unique about chronic inflammation with cancer is that chronic inflammation in the body actually causes cancer. So it's not only in a commonality between these other diseases, but the process of chronic inflammation in the body, the degradation and repair, damage, repair, actually causes cancer to form in the body. Well, what is a cancer cell? Let's understand that first. Cancer is what I call basically a cell that has disconnected from its natural state of health. And how has it done that? It's lost a majority of its mitochondria. And how have the mitochondria died off? Well, they've died off for a number of lifestyle and diet factors. Foods that kill the mitochondria, toxins that kill the mitochondria, inflammation that kills the mitochondria, stress that kills the mitochondria. All these causes that I just listed will damage mitochondria at a cellular level and cause that cell to survive. Cancer is a survival mechanism at a cellular level. So just like, if you were in a life or death situation and you had an option to live versus die, most of us would choose to live. It's like if you're hanging over the side of a cliff and it's like you had a little bit of a chance to try and pull yourself up and survive, we're all going to try that, right? Unless you're, suicidal or so depressed or have zero hope, okay, you're just going to let yourself die. Or selflessly, sometimes, we will sacrifice ourselves for somebody else. But at our core, we all want to live. We all want to thrive, right? We want to go beyond just survive, but at a survival level, our cells are the same thing. Our cells want to survive if they can, if there's a chance of hope for the cell to survive. So how does it do that? It goes from what's called healthy cellular respiration, also known as oxidative phosphorylation, which produces about 36 ATP, the energy source of our cells, right? This is interesting. You don't have to know all these words for people tuning in. Some of you might, some of you not. It's not that important. A healthy cell produces 36 ATP. A cancer cell starts to chronically ferment and switches to aerobic glycolysis and only produces 2 ATP per molecule of glucose. All right, so we need glucose, we need sugar, ideally healthy sugar, from fruits and vegetables and good carbohydrates, beans and legumes and all of these things. We need sugar for every function of our body. A cancer cell rapidly produces, to stay alive, to survive, by fermenting, which is highly inefficient. It's only producing 2 ATP. So healthy cell, 36. An unhealthy cell, a cancer cell, 2. So because it's only producing 2, because it's lost a lot of its mitochondria and lost a lot of its mitochondrial function, now it has to rapidly replicate to try to keep up with the healthy cells. So people go, why does cancer rapidly replicate and just spread all over the body? That's my theory why. My theory why is because, look, it's only producing 2 ATP. It's trying to stay alive and it's trying to keep up with the processes of the body. So if it can only produce 2, then what's it going to do to try to make up for the 34 that it's not producing? Well, it's got to replicate really fast, right? So the cell is just trying to stay alive. It's trying to survive. It's trying to keep you alive. Because imagine if all those cells just immediately died. I don't think I think what would happen is we would go into complete organ failure and probably just die. So the cells are trying to stay alive. So we're making cancer. Our bodies are making it to stay alive. Why? Because our diet and lifestyle and stress have damaged our cells to a point where they are no longer healthy. They're unhealthy. They're trying to survive. And through that process, we get cancer. Well, we make cancer, not get cancer. Let's choose our words here, right? We make cancer. Well, even then, you can live with cancer for 10, 15, 20 years and not even know you have it. Most cancer takes 8 to 12 years before it's even diagnosed. It's been forming in your body all that time. 8 to 12 years before it's even diagnosed. There's some more updated testing you can do now that can try and catch cancer at an earlier stage. You can test different kinds of biomarkers. There's a great test you can look up. I don't know if it's available everywhere in the world, but it probably should be, called the Cancer Profile Test. And they look at a number of different hormones and biomarkers to say, hey, yeah, it's very likely you have cancer forming in your body, or hey, you're at the really early stages of what looks like potential cancer. Let's make some changes now. Or for sure, you've got cancer in your body. Look at all these biomarkers. The Cancer Profile Test is a really good one. You don't necessarily have to go get a PET scan or or any of those kinds of things. So going back to the fuel source for our cells, we need glucose, but not all glucose. We look at sugar and think, oh, all sugar's bad, but not all sugar's bad. When you look at all the studies that have been done on the sugar in relationship to the body responding in a negative way, creating, insulin resistance, leading to diabetes, type 2 diabetes, leading to autoimmune disease, leading to heart disease, right? Insulin resistance is the underlying factor there. All of those studies that look in depth in that use things like high fructose corn syrup, use things like highly processed sugar in those studies, and they don't use things like fruits and beans and vegetables. And in fact, when you look at all the studies that do use fruits and beans and vegetables and berries, they actually see the opposite, that cancer starts to be put at bay, that diseases are being fought against, because all of those foods have phytonutrients, minerals, amino acids, vitamins, all, fiber, water, all the things our body needs to thrive. So if you want to know what the anti-cancer diet is, that's what it is. It's greens, beans, onions, mushrooms, berries, nuts and seeds, and herbs. That's the best anti-cancer diet, and in a nice variety of that every single day. We know through tons of studies that increased meat in the diet can lead to cancer. We know increased dairy in the diet can lead to cancer. We know that processed meats are for sure carcinogenic and they lead to cancer. Dozens and dozens and dozens of studies. And we know that when you increase plants in the diet and reduce animal products, and you get a good diversity of these plants, they have, like the green vegetables, the cruciferous vegetables full of sulforaphanes. Sulforaphanes are highly anti-cancer. You get the berries in there, which are full of antioxidants and fight off the free radicals that can damage the cells. You get the mushrooms in there, which are incredibly anti-cancer. A lot of good medicinal mushrooms, maitake, shiitake, basically any mushroom that you can, any edible mushroom, you cook with it. You can take powders, capsules. Reishi Ganoderma is a really famous anti-cancer mushroom that has tremendous immune system protective value as well. So the underlying, so we're primarily on the physical here, and then we'll touch some mental, emotional, spiritual, as you talked about. But the other piece to that is we've been talking a lot about chronic inflammation. Well, how do you get chronic inflammation down in the body? Well, you get the inflammatory foods out of the body and get the anti-inflammatory foods in, which is primarily all those plant foods we just talked about. But how else do we get the inflammation out of the body? Well, we got to get the chemicals out of the body, the toxins that are coming in from the water, from the pesticides that are sprayed on the foods, from the chemicals that are in the air, the chemicals that are in our homes. So if you live in a house, there's a study done by NASA that 1 plant per 100 square feet. I see those plants behind you. I don't know if they're real or not, but I'm sure you have real plants in your house. 1 living plant per 100 square feet will help clean up the VOCs, volatile organic compounds, in that part of your house, so that you're not breathing those in, causing inflammation and potentially carcinogenic effects in the body. So if you have 1,000 square feet, and I don't know what that is in meters for our international folks, 300 square meters, I think. If you have 1,000 square feet, then you have 10 plants spread throughout the house, 1 plant per 100 square feet. And that cleans up all the air. Hey, we've taken care of the air. It's pretty simple. Or you buy an air purifier, if you can get one of those, and that cleans up the air as well. Then we need to filter the water. Reverse osmosis is great, but I really like, hydrogen infused water. But of any kind of water filter, we need to filter it out. A basic charcoal water filter, and if you add some reverse osmosis, that's great. Get the chemicals out of it, because those chemicals are damaging the mitochondria. They're causing chronic inflammation, and we know this to be true. I have an entire hour and a half webinar on all the research and science that proves this to be absolutely true. So we know we need to clean up the water, and then we got to clean up the food. Eat the healthier, alkaline, anti-cancer foods, ideally grown with no chemicals, because we know those chemicals, those pesticides, some of them are carcinogenic, some of them are endocrine disruptors, disrupt our hormone system, cause major inflammation in the body, cause our hormones to go out of whack, which can lead to cancer formation in the body. So, that really gets chronic inflammation under control. But what else causes chronic inflammation? Stress. So people don't realize it, but stress is so inflammatory to the body because it activates an adrenal response, right? The adrenal response is the fight or flight, the sympathetic nervous system. That feeling you get when you're angry or upset or yelling at somebody, or you're scared and afraid, or you're depressed and sad. All of these emotional experiences activate a sympathetic nervous system response, which downregulates our immune system. And again, going back to Dr. Lodi, a good friend of mine, he said in my documentary, he said, there is a cure for cancer. It's called the immune system. And when you have a fully functioning immune system, you never have to worry about a cancer diagnosis. And it's absolutely so true. Our immune system is designed to find, destroy, and recycle and remove cancer cells from the body. That's one of its main jobs, in addition to finding and destroying viruses and bacterial cells and infections in the body. Our immune system is so intelligent. Could you imagine if we had to direct our immune system? Hey, all right, let's produce this lymphocyte, and then this leukocyte, and this inflammatory, and this T cell, and this natural killer cell, and then we gotta go find this cancer cell, gobble that up, let's recycle it through autophagy, and then let's repurpose the mitochondria, and da-da-da. And it's like, our body does all that by itself if we just give it the right environment. We give it the right foods, we nurture it with stress-reducing activities, we sleep well. Sleep is an essential component. 8 hours the studies have shown 7 to 9 hours is basically the sweet spot when it comes to the amount of sleep we need for our bodies to do what it does, enter a state of autophagy in the deep sleep portion of our sleep and clean up these abnormal cells and these cancer cells. Well, if you're only sleeping 4 or 5 hours a night total, you're missing out on a significant amount of healing power that your body has. So we know that when we practice stress reduction practices, yogic breathing, meditation, pranayama, qigong, just relaxation, sitting, observing nature, going out and forest bathing, which was made popular by the Japanese culture, going out and walking in the forest, no cell phones turned on. When we go walking out in the forest, I bring my phone in case there's an emergency, but I turn it off completely, right? So, a little smart trick there for hack there for people. It's like, don't go out and be by yourself, out in nature 5 hours away from everything and not be able to reach anybody, but go out and be out there and turn your electronics off and just be in nature. It's incredibly healing and soothing. But a lot of Elaine Gibson is a good example, a good friend of mine. She's in her 70s. And when she was diagnosed with stage 4 cancer, they told her, she was in her 60s then, and they said, you won't see your grandchildren grow up. That's what the doctor told her. Terrible thing to say to somebody, and good thing for her, she didn't accept that, which is one of the qualities of the 12 exceptional healing attributes as identified of cancer survivors, not accepting the prognosis. I do not accept that 3-month prognosis or that 1-year prognosis. I call it the fake expiration date that the doctor gives you. Those who overcome the fake expiration date, every one of them said, no, I don't accept that. I'm going to find another way. And so that mental shift is so important and so essential. I'm going to learn about it. I'm going to talk to other doctors and other people. I'm going to read other books. I'm going to do everything I can to learn everything I can about this, to beat this. And it's the same for prevention. Everything we're talking about for helping heal the body is the same thing that we do to prevent against cancer in the first place. It's the diet, it's the stress reduction, it's the sleep, it's the cleaning up the toxins. These things are all essential. But the thing that Elaine told me was she started meditating 1 hour every morning and 1 hour every evening, doing all different kinds of meditations. And she knew that was one of the biggest determining factors for her to get her stress under control, to get her body in a state where it's healing, at a significantly higher rate. And she did lots of green vegetable juice and exercise and sauna and cleaned up her water and air, all the things we talked about. But one of the biggest things that she talked about, as well as another friend and colleague of mine, Dr. Veronique Dessonnier, who reversed her breast cancer, same thing. I started meditating an hour every morning, an hour every night, same thing. And both of them had a recurrence before that. So the cancer came back and I said, well, what did you do different this time? I started meditating. Like what, that's a common thing that I see again and again. Parkinson's disease. And I said, what did you start doing differently to reverse Parkinson's disease? Oh, I started practicing hours a day. She was practicing Qigong 3 hours a day. Her Parkinson's went away. Bianca Mole. What did you do to heal dysautonomia and chronic fatigue and bedridden for 10 years? I started practicing Qigong, meditation, sound healing, breathing practices, etc. for 2 hours, 3 hours a day. People go, I don't have that time. Well, how important is your life to you? How important is your future to you? I mean, if you have a stage 3 or stage 4 cancer, it's like you got a chance to not only live, but have a better quality of life and maybe add 10 or 15 more years to your life to be with your children, your grandchildren, your friends, your family, fulfill your life purpose on earth, contribute to society and humanity in a meaningful way. Look, if that means doing an extra hour twice a day and you feel amazing doing it, you feel better, you have less stress, you have more energy, it's like you reclaim your life. Who wouldn't want that? But for prevention, you should have a practice. You should have at least a daily practice of something, pranayama, qigong, yoga, something where you are and not the necessarily the physical yoga of the West, even though that's incredibly beneficial. But when I'm saying yoga, I'm talking about more of the ancient yogic practices from India, which is a lot more meditation and deep breathing, as many of you know, right? So the practice of being still, quieting the mind, helping our bodies to heal, that's so essential. And I know we're running out of time, but that's basically, we talk a lot about body, mind, and spirit, and it's all intertwined and essential. And our modern science, our ancient ancestors have known this for thousands of years. Our ancient, the Vedas and our ancient yogic gurus have been teaching this for thousands of years. On the East side, the ancient Qigong masters have been teaching this for thousands of years. But what's interesting is that our modern science is now explaining the physiology behind how all that works and proving it to be true from a scientific mechanistic viewpoint, even though many people already know it to be true in their own heart. Our modern science has finally caught up to it, and it's a beautiful thing.
Yes, yes. Well, this has been really wonderful. First tell us about, I know you have a new site, Healing Life. So tell us about that, because I know that you're going into all these different realms of healing, and it's very exciting.
Yeah, so along my journey, I've just discovered how powerful energy healing and energy medicine is for healing not only cancer, but all chronic health conditions, depression, stress, anxiety, physical ailments, Parkinson's disease, as I said. And so, I had this vision come through. I wanted to create a wonderful online community of master Qigong teachers and connect with people who want to learn energy healing and energy medicine, and put it all together in one place. So we started as a educational membership site that teaches diet and nutrition and all forms of different healing, Ayurveda, Qigong. We bring practitioners in to answer members' questions about whatever health condition they have going on in their life. And so it's a great educational resource. And over time, it's becoming a practice resource. So we have energy medicine yoga happening 3 times a week right now, live classes as well as recorded classes. We're launching new energy healing master classes that have teaching and practice. And over time, we will have a lot more live classes in there of different energy healing modalities, different forms of group healing, different forms of healing circles. So it's going to shift, or it's morphing into its next level of basically online community of people who want to learn more and experience the power of energy healing. And so that's what it's becoming. And it's beautiful how it's kind of starting to morph into that butterfly right now. It started as one thing and it's now transitioning into its higher level of what it's meant to become. But yeah, that's Healing Life. People can try it for free. There's a free trial. That's at healinglife.net, and it's all over the world. We have people in, I think, 50 countries a part of our membership.
So how do people get in touch with you? I know that many of our audience would be very interested, and I'm sure you'll get some invitations to speak in some very interesting places from this interview.
Well, thank you. I appreciate it. I love speaking. It's one of my favorite things to do, is to research and learn and then share it with others. So, my website's probably the best place to get in touch with me, nathancrane.com. And there's an email there. If somebody wants to reach me for speaking, like a speaking engagement, a podcast, at a conference, whatever, there's an email there for that. And then there's also my ebook you can download. Anyone can go download for free. It's an Amazon best-selling book, but I just give away the ebook version for free. You can go download that at my website too. That's just nathancrane.com.
Excellent. Well, it's been a joy to have you here. And we hope to bring you back in the future. And thank you so much. Namaste to you.
Thank you, Sharon. Thank you for having me. I appreciate it. And much love and many blessings to this beautiful community you have here. So thank you.
Global namaste to you all. It's such a pleasure.
And Sharon, here is Nathan Crane's website. As he said, nathancrane.com. It's a wonderful website where you can visit. It's very easy and simple, and you can also contact Nathan on there. And he has also got lots of his associates who are also associated over here. So well done, Sharon. That was a lovely interview.
Yes, he's very knowledgeable. I mean, so many years of research and bringing people together and documentary filmmaking and, you know, online summits. So I was really happy that he could join us today. Hi, Keith. Nice to see you here. Hi, Keith. Okay.
You can
Well,
unmute yourself, Keith. You need to unmute, yes.
Okay. Sharon, hello.
Hi. So have you met Nathan? He's very involved with the Qigong and Tai Chi community.
I have never heard of him, right? But that is not a failure. It is a learning process. I am absolutely amazed at the number of specialists throughout the world, including yourself, and listening to Dr. Amrita, all right, okay, is that you know that I am not a specialist. I love listening to people and thinking, I never knew that. I've written down a question here. How do we sell the promises and the enthusiasm of Nathan Crane and his work to the health authorities and subsequently to the general public? I use a term called end user. And I hate to be very quantifiable, I suppose, from an engineering background, but yes, there is lots of science, but we need to have it identified in a clear and understandable and proven way. I started Parkinson classes here in the UK. It took them 6 months to convince me that I should run a Parkinson's class. I did, using some elements of Tai Chi and Qigong, but from a medical perspective, I never get involved. But the cheer that I got from seeing people walk into the class, whether they could walk through the doorway or not, or whether they floated across the room without smashing one piece of furniture or glass, I was gobsmacked. I'm now learning many, many years later of all the wonderful work being done by people like Nathan. But of course, it's how do we collaborate? How do we join forces? And you know that from my perspective, it's a case of how do we use an umbrella to keep everything together?
That's what Nathan is creating with Healing Life. That's what's so exciting. Not only does he have very deep knowledge of the healing arts, and particularly of Qigong. He worked with Mingtong Gu for a long time and still is. But he's a very good marketer. And I think that's what we need. We need people who really know how to get it out. So that's exciting. And I want to bring in, we have another guest coming in.
Sharon, can I just say something? That was really wonderful video, actually. And I love to meet him personally. Well, but the kind of integration he has about the the umbrella that just now Keith talked about, which is so important. And in that umbrella, every spike has its own role to heal an individual. And when all the spikes come together and they put one stick, which you are holding, and that's the stick of faith, I would say, that's the stick of enthusiasm in yourself, self-confidence, that's the stick of your love for yourself, and that builds up the faith to live life. And I'm really very happy to see all these things together. We have Neilji over here again. Your comments, please.
Thank you, Amrita. Thank you for your comment. Keith mentioned, how do we create an umbrella? Well, that's what Healing Our Earth is. Healing Our Earth is an umbrella for all the organization. It then unites people. It actually shares information and creates private social media groups, email groups, WhatsApp groups. And now there are lots of groups of Ayurveda, yoga, integrated health, alternative medicine, wellness, well-being. So Sharron, you as a coordinator of USA, you bring in so many facilitators to us. Let's build in. Of course, Keith Sharp is a resident panelist at Healing Our Earth. Behind the back, he's already working with few people, including Bill Douglas and other people in America, together with our people down here, Mohan Thangwalu, Rajiv. So hopefully by tail end of this year or early next year, we could have actual conferences in main cities of the earth, and then we can meet in and develop and bring the unity, harmony, peace, liberty that Healing Our Earth subscribes to. Let's move on to and stay in USA with friend Bailey, and let's introduce her, Sharron.
I'm very pleased. So many of you know that I've been involved in dance not only as entertainment, but as a spiritual art and as a healing art. And so I was very pleased to meet Fran, who is also a dancer. She's going to be talking about cancer and Shiva methods, seeking harmony in energy, voice, and action. Fran Bailey's extensive training in dancing combined with energy healing has evolved into a simple method for evolving the mind, body, heart, and soul since 2002. She has channeled her passion in the Shiva method, seeking harmony in energy, voice, and action. This process resets your system to restore with practical techniques to live more consciously through energetic awareness. For 12 years, Fran worked as an energy healer for the Alliance Institute for Integrative Medicine in Cincinnati, Ohio, and so much more. She has an extensive bio. So I'm very pleased to have you here with us, Fran.
Thank you so much. Say thank you so much. I appreciate that. And I loved our conversation yesterday about our training and similar people that we trained with. Is always a joy to roll back and sort of take a look at that. So go ahead.
Let's start with dance, because there's something very interesting. And I think it relates to all dancers and to healing in general. And it's that as dancers, we have developed a high level of kinesthetic awareness.
Mm-hmm. Mm-hmm. Absolutely. Yeah. I definitely, as a young child, I was dancing all the time and learned at a very young age. And I think that the combination of music, understanding the body, understanding the anatomy, because I had to study anatomy as a major in dance, intensely. And so the interest of how the body flows and how the music comes and how we relate and how we express an emotion or however, we have to be so quick and so definite in our movement. And I think that takes an body intelligence. And that's part of the Shiva method, is teaching all about the body intelligence and how the body moves through the chakra system, through the meridian system. And that's how I began the Shiva method, with, knowing the body first, then deep meditation, teaching about the chakra system. And then I learned the Enneagram, which is study of personalities. So it kind of pulled all together. All of those systems are put into the Shiva method. So the main emphasis is the body doesn't lie. So if we can recognize issues in the body, or, you know, if we are scanning our body and then find pressure points and say, wait a minute, something isn't right, or find that the chakra is spinning the other way, or just learning what the body is communicating to us is really the answer, I think. So interesting listening to the gentleman before. My experience with cancer. I also had cervical cancer, stage 4, after my father died of prostate cancer. So looking at this and reviewing my issue, or my experience with cancer, is that, you know, we all have cancer cells, and it's just, as he said, if things aren't going to the flowing, and if you are not spiritually connected, or if stress is, you know, I had 3 young children, my husband wasn't traveling, and I went to a new house and helping my mother's loss and my own, and then my body just went boom. I think it just, you know, said, okay, stop.
It's the stress.
It's stress. Yeah, emotional stress for sure. So that's that first and second chakra. Bingo. To me, that was like, well, of course, I've lost my father. I want to go with him. You know, I don't want him to leave. And so I think the body made a connection. And so, you know, my doctor said, well, you have stage 4. Let's get a hysterectomy. And, you know, by the way, get a tummy lift because you had twins.
Oh, no.
2 male doctors said that to me. I went, really? So I got a female doctor, and she said, no, you do not have to have a hysterectomy. You just go through a long period of coming back to see me every 3 months. And so I did some procedures, but at the same time, I was beginning my spiritual path with Rosalind Briere, who is out of California. She's a medical intuitive. And I worked for the Alliance Institute for 12 years. And I said, wow. And working with John Friedlander and Gloria Hampshire on chakra clearing, deep chakra clearing. I said, I think I'm going to work on myself. So Rosalind had a technique of actually shrinking the cell muscles, or cancer cells. And I started doing that daily, releasing guilt, shame, because cancer brings shame. And I said, my body's full. I'm going to be creative. I'm going to bring love into that area in my body. So it was really an incredible process. But the clincher was, I was definitely on the spiritual path, and Babaji, right behind me, is my main guide. And the spiritual path sort of chased me at 12 when I had a near-death experience, and at 19 when I lived in California, and then at 26 and 30, and then finally, after my 3 kids and this experience, my spiritual awakening came. So I was sitting in this room. This is a studio, in this chair, and I said, all right, am I going to dance? Am I going to heal? Am I going to do both? How am I going to do all this? So I hear this voice, and he says, bring your hands out like this. I said, okay. And he says, now look down to your left corner. And I saw these feet, 2 feet in sandals. And I looked up, and there was some cloth, you know, there was like a robe. And I went, no, it can't be. So he said, touch the cloth. Now, I'm not going to say who this is, but it was certainly pretty powerful. And so I touched the cloth, and of course I fell out of the chair in tears, and the energy that was transmitted into my hand with the touch of that cloth, and the humbleness in which that happened, that was like, bingo, you found me. So he said, hold your hands out like this. I said, okay. And he put his hands on mine, and he said, "You can dance." And he said, "Flip them over." And he put his hands underneath mine, and "You can heal." And with that, I went, I think I'm going to do that. So the power of touch, the power of intention, the power of energy transmission, I'm a total believer. I've had a lot of success with healing. And I think that, you know, the body doesn't lie. It's mind over matter. It's developing the trust of knowing your own intuition. And the Shiva method is dedicated to self-healing. So, you know, there's meditation, there's body work, there's my book, Emergence. And it's all on my grandbailey.healer.com. And I do individuals and classes. And it's a foundation. And I think it was a gift. And I treasure it and, you know, live by it. And I really think that with this positive energy that we can shift so many things. So I worked on a lot of cancer patients and through the Alliance Institute with MDs, with doctors, but also here in my studio, that they would come here for healing work to take out the toxins. Number one. Number two, I would always say that you were whole and that you're just changing. It's an interruption in your life. And that it's important that you know that you're surrounded in love in every cell of your body. So it's that kind of impetus and that kind of positive reinforcement. So anyway, I'm thrilled to be here, and that's sort of my story. And
well, it's a beautiful story. It's a beautiful story. And I know that you have you are a magnificent healer.
Yeah, thank you.
And for all of you out there that know our dear friend Kathy Mason, they grew up together, right? Kathy?
Yeah.
Yes. And that what we would like is to experience one of your meditations. It would be a beautiful ending to the show to really have that energetic experience of what you bring.
Okay. I will do that. So in this work, and of course, as we know, as we advance in discovering our abilities, the speed in which healing is coming right now is so fast and so clean and so clear. The veil is very thin. So it's not as much as what I am saying, it's the actual energy transmitted. So I'm going to go through the chakra system, and we're going to clear each center. I'm assuming you all know what chakras are, 1 to 7. And then we're going to go through the layers, 1 through 7. And then we're going to go clean the organs, each organ, which I think you will really enjoy. It's kind of you either get really sleepy or you are really energetic. So I'm just saying, and if you're driving your car, please ground your wheels. It's really important that you do that just to stay centered. So in this system, we use a grounding cord from the very core of the earth. And do you want me to go ahead? I guess I will.
That's wonderful.
Okay. So find a comfortable position, whether you're sitting or laying down, and we use a grounding cord. And we ground the first 2 chakras, and then the gold cosmic energy from 7 to 3, clearing what's not serving you, any contracts, karma, energies that are not yours. And we put this energy in a tool that you create. And so you can release the energy past the edge of your aura. Of course, the edge of your aura is the width of your arms, tips of your fingers, to the sides, above, front, back, and below. So we're going to clear each center, and then we'll start with the organs, and then we'll finish up. Okay. So let's focus on the first chakra at the base of the spine. And I want you to create a just a disc or a little sphere right where the grounding cord would come in, about 3 inches in diameter. Grounding cord is 4,000 miles down. You want to bring that energy up into the first chakra and attach it to that space you created so that it's filled. And I want you to male or female ground. So bring the cord into your male or female reproductive organs and your left and right sciatic. Down the back of the legs, attaching to the heel. We're going to bring an earth energy into your feet, your ankles, your shins, your calves, and your knees. So I want you to create some tools around your lower legs and just practice releasing them past the edge of your aura. And again. And again. Good. And bringing that earth energy into the feet, ankles, shins, calves, and knees, releasing any energies that are not yours. Contracts, karma. Place these energies on the tools you've created and move it past the edge of your aura. Just a simple clearing, moving into your thighs, into your bone marrow and the femurs. Good. Releasing contracts, karma, energies that are not yours. Place those energies on the tools you've created and move it past the edge of your aura. Good. Move into your first chakra at the base of the spine. This is the earth element, the color red, 4 petals. This is about survival pictures. Coming from you or someone else. Unfold each petal. Gently, starting from the front all the way around, go into the center of that chakra. This is the earth element. Move it into the first layer, which is the shape of the body. Place any energies that are not yours, contracts, karma, energies that are not working for you at this current time. Unfold the tailbone. Release that energy. Place it on the tools you've created and move it past the edge of your aura. Moving up higher now to the second chakra, pubic bone to belly button. This is the color orange. This is the emotions. This is water element. Releasing any excess emotions coming from you or someone else. This is boundaries, creativity, sexuality. 6 petals, color orange. Unfold front, all the way around, gently. Move into the center or core of the chakra. Clearing the second layer. Good. And move it past the edge of your aura. Take a deep breath. We're going to move up into the third chakra, belly button to breastbone, bringing in gold cosmic energy from above the crown. Let it come into the crown, into the upper body, assisting you in clearing the third chakra. Element fire. There are 10 petals in this chakra. This is about the ego, alter ego, looking for the authentic self, being present. Unfold each petal front. Go gently around, really gently unfold each one. Move into the center or core of that chakra, clearing the third layer as well. Place those energies that are not yours on the tools you've created and move it past the edge of your aura. Take a deep breath, stay present, as we move higher in the fourth chakra at the heart. This is the color green. This is the air element. So take a deep breath. We're going to unfold 12 petals, releasing karma, contracts, energies that are not yours. Move into the core of the fourth chakra, center, clearing the fourth layer. Place those energies and the tools you've created and move it past the edge of your aura. Take a deep breath. Good. Moving up higher now to the fifth chakra, the communication center. Larynx, telepathic channels in the ear canal, sinuses. 16 petals. This is a turquoise blue. Unfold gently each petal, releasing karma, contracts, energies that are not serving you in this current time. Good. We're looking for the authentic voice coming from the authentic self, speaking through the heart. Clear the fifth layer. Move that energy past the edge of your aura. Good. Moving up higher now to the sixth, center of the head. Create a ring of tools around your head to release busy thoughts, pattern thoughts that keep you ungrounded. This is the clairvoyant, intuitive self. Releasing any karma, contracts, energies that are not yours. Third eye, 2 petals between the brow. This is the integrative center, releasing contracts, karma, energies that are not yours. Clear the 6th layer and move it past the edge of your aura. Take a deep breath, check your grounding cord. Nice. Stay with it. Move up higher and out of the crown. There are 1,000 petals. Imagine a fan running through them to release any resistance to higher self, source, God. This is the color violet, the 6th with purple. Create some tools above your head to release karma, contracts, energies that are not yours. Place those energies on the tools you've created, clearing the 7th layer and move it past the edge of your aura. Scanning your body and your layers from head to toe, 7th layer, 7th chakra, top of the head, 6th layer, 6th chakra at the center, 3rd, 4th, 5th layer, 5th chakra at the throat, 4th layer, 4th chakra at the heart. Include your arms and hands. 3rd layer, 3rd chakra at the stomach, 2nd layer, 2nd chakra. Sacrum, belly button to pubic bone, and 1st layer, 1st chakra at the base of the spine. Send that energy down the grounding cord where Mother Earth will rejuvenate, regenerate, and recycle for you. Release your old grounding cord. Don't follow it. Let her have it. Create a space at the base of the spine for a fresh new grounding cord to come into your 1st chakra, male or female ground, left and right sciatic. Bring in fresh new earth energy into your feet, ankles, shins, calves, knees, thighs, into your 1st chakra at the base of the spine and 1st layer. Feeling safe, grounded, present. Bring it into your 2nd chakra, pubic bone to belly button, allowing that higher creative self to be present. Include the 2nd layer. From well above the crown, I want you to bring in fresh new gold cosmic energy. Let it come into your crown. Let it trickle to the back of your head, upper back, middle back, and into the open third, balancing your ego, finding that authentic self, present, creative, safe. Include this third layer. Bring it into the fourth chakra at the heart, allowing love to be present, self-love, abundant love, breathing in abundant love through the whole body, below and above, through the arms and hands and legs. Include the fourth layer. Fifth chakra at the throat. Bringing in fresh new gold cosmic energy into the fifth chakra, communicating with the authentic self through the heart. Keep this open as wide as comfortable for you. From 4, 5, 6, and 7, keep them open. Include the fifth layer. Bring it into the sixth chakra and sixth layer. Keep that open. Seventh chakra and seventh layer. Feel the edges of your aura. And you in the center. Take a deep breath and be present. Good. We're going to go, I'm just going to go straight into the organs because I think you're kind of in the zone. So what I do with the organs is I run the color, the chakra colors, red, orange, yellow, green, blue, purple, violet, if necessary. So we're going to focus on the brain. So we're really clearing, we're balancing these organs in our body, clearing any toxins. So it's a brain balance on 2 hemispheres in the brain, red, orange, yellow, green, blue, purple, and violet. We're going to move into the eyes, red, orange, yellow, green, blue, purple, violet. Take a deep breath. Good. We're going to go into the vagus nerve, running to the heart, stomach, and on either side, and the sciatic nerve, red, orange, yellow, green, blue, purple, violet. Going down the throat, esophagus, red, orange, yellow, green, blue, purple, violet. Into the diaphragm. Take a deep breath. Red, orange, yellow, green, blue, purple, violet. Watch the diaphragm breathe up and down, sideways, filling the lungs. Inside the ribs, red, orange, yellow, green, blue, purple, violet. Moving into the heart, red, orange, yellow, green, blue, purple, violet. Into the spleen, the filter, increasing those good cells, releasing the toxins, red, orange, yellow, green, blue, purple, violet. Move over to the left, into the liver. Another filter, red, orange, yellow, green, blue, purple, violet, gallbladder, red, orange, yellow, green, blue, purple, violet. Into the stomach, digestion, red, orange, yellow, green, blue, purple, violet. Pancreas, red, orange, yellow, green, blue, purple, violet, small intestine. Red, orange, yellow, green, blue, purple, violet, large intestine. red, orange, yellow, green, blue, purple, violet. Kidneys in the middle of the back, and adrenals, red, orange, yellow, green, blue, purple, violet. Into the bladder, red, orange, yellow, green, blue, purple, violet. Reproductive organs, breathe. Nice, stay with it. Epidermis, red, orange, yellow, green, blue, purple, violet. Fascia, muscles, red, orange, yellow, green, blue, purple, violet. Tendons, red, orange, yellow, green, blue, purple, violet. Ligaments and bones, red, orange, yellow, green, blue, purple, violet. Feel the vitality of the blood cells running through you. The blood cells, red, orange, yellow, green, blue, purple, violet. Take a deep breath. Scan your body from head to toe, releasing any excess energy. Send it down the grounding cord. Release your grounding cord. Create a space for a new one. Bring in fresh new earth energy into your legs. First and second chakras. And fresh new gold cosmic energy from the crown to the belly button, balancing the two energies. Saying hello to your new body, your new energy, the vitality. Take a deep breath, and when you're ready, you can open your eyes.
Thank you. I think we all need this every day. You know? As Nathan was saying, you know, the power of meditation, the power of bringing this clear, present energy and connecting with the part of us that's already enlightened, like the guru within.
Yeah. I mean, it's just this, I could feel even in this process, it's like we're all in it together. It's just like one unit, and it's beautiful. So it's great.
Thank you, friend. Thank you, Sharon. That was wonderful presentation. Sharon, what we will do, earlier, Fran was talking about Shiva method. Let's share her website so people can visit her, which is Fran Bailey Healing. And here she is very clearly demonstrating what the Shiva method is.
Oh, wait a minute, that's the wrong site. This
is not you?
No, that's the wrong one.
That's not your website?
No, franbaileyhealer.com. Try that.
This has got your picture on it, Fran.
That's strange.
An old one.
Let me just quickly show you. It's Fran. One moment. Bear with me one moment. It may be wrong, but I think, is this you?
Yes, but that's an old site.
Okay. So what is your new site? You need to get it blocked, or you need to get it repointed.
Okay, sorry. Yeah.
To the new one. You can ask the domain provider to park it and just point it to the new one. If you could remind the viewers, what is the new website?
It's franbaileyhealer.com.
franbaileyhealer.com.
Yeah.
Okay. Very good.
And
so this domain is frankbaileyhealer.com. Maybe if you get it checked, if it's mixed up, because the domain that I was showing was frankbaileyhealer.com.
Well, I'll have to ask Kathy about that.
But it's beautiful. It's beautiful. You very clearly explained there what it is, plus together with the other facilities that you provide, which is
Yes.
also beautiful. So I think the viewers should go and point when you send the WhatsApp the right ID again, maybe we'll just send it to people. Let's start concluding now. We're running half an hour late. And Amrita, what's your comment? And then Sharron can nicely round off with Fran Bailey. Your sound is gone, your microphone.
Hi, Fran. That was really wonderful. I could really feel the energies passing from my chakras, from the Mooladhara chakra to the Swadhisthana and the Sahasrara chakras. And that took me way back. And I'm really proud how the ancient science of India, because I come professionally, nationally, I'm an Indian, and teaching and preaching yoga and Ayurveda, it gives me a lot of boost to see how these cultures and traditions have been implemented worldwide and how many people are getting benefit on so many bases, not only physically, mentally, emotionally, spiritually. So it's a pleasure meeting you and a wonderful job that you've been doing. And I can also feel the aura of your home, if that's your place, where I can see the stones and the stone healing things, which is with the gurus. I think that is Lari Mahashay, and I can recognize the gurus.
Many years, yeah.
That's really nice. Little India I can see and peep into from the camera. That's really wonderful.
Thank you.
Thank you so much. Been really great. And Sharron, you've been already great with everything, what you've been doing. And it's an amazing journey for me to share this platform as well with everyone. And thank you so much.
You're so welcome. It's a joy to have you here.
Thank you.
Well, Fran, that really helped me. I'm going through a detox right now. I got hit by a bunch of toxins in the air here from the winds. And so that was very helpful to me, and I'm sure to our audience. So
good. Epsom salts.
Yes, I did it last night. Epsom salt, soda. Yeah.
Good. Well, I'm thrilled to share it, and it was a joy to be with you and feel the energy of all these wonderful people. And I will send you the right website.
Wonderful.
I'll ask Kathy. Yeah.
Thank you. And to all of you out there, we have both gone through cancer, and we are vital women now. And all of you can do it. The Healing Our Earth is dedicated to helping all of you out in the world to heal and to connect with your deepest, highest self. So thank you all for being with us, and we look forward to seeing you next week. Global Namaste. Oh, here we are. Next week, very important show, World Environment Day. Beat plastic pollution for sure. Sunday, June 4th, 2 p.m. BST onwards. And we'll have some wonderful guests, I'm sure, really talking about the issues, the deep issues that we are facing now. And then, hey, well-being and wellness for a happy, healthy, peaceful body and mind. Sunday, the 11th of June, 2023. I'm sure that will be, look, wellness in every level. Maybe we can bring some dance wellness in as well. Then the International Yoga Day Special, which is always a wonderful show, bringing in yoga teachers and practitioners, scholars from all around the world. Join us for this free global. And then another, yes, we have so many amazing yoga teachers, practitioners, scholars, etc., that we have to have it twice to give you so much to practice with, so much to think about, so much to bring into your lives on Sunday, the 25th of June. And then Guru Purnima, yes, where we pay homage to all of our gurus. And that will be on the 2nd of July. So we have some wonderful shows coming up for you. We love you. We bring you joy, abundance, bliss, and true healing. Thank you.